wish. You and Dr. Nayeem, as you wish, both of you.
Yeah, it's already 10 minutes late, so let's start.
Okay.
Yeah.
Please.
Good afternoon and good evening, everyone. So, without further ado, I would like to ask Dr. Anwar Saab to start with opening remarks for this session.
Hello, a warm good evening to all of you. I am Dr. Anwar Khurshid, the Vice President of Saudi Indian Health Forum. This forum functions under the patronage of Embassy of India, Riyadh. It provides a platform for the medical professionals from both the countries to develop linkages in the fields of healthcare, medicine, pharmaceuticals, and allied sectors. One of the important areas of the activities is to create awareness about the use of Indian systems of medicines like Ayurveda, homeopathy, Unani, and naturopathy. Homeopathy, as you all know, is a worldwide use for over 200 years. It is quite popular in countries such as India, China, Mexico, United States, Brazil, South Africa, Germany, Belgium, Switzerland, and United Kingdom. It focuses on treating each person as unique individual so as to stimulate their own healing ability. It is considered a powerful ally to conventional medicine. The demand for services in this area is on the rise. The forum has taken an initiative to familiarize alternative medicine in this part of the world, and it is the first step in that direction. We are fortunate to have professionals of high repute in the field of homeopathy as our panelists today. As you can see, the big names are there. They shall highlight why homeopathy is becoming more relevant in these critical years. To conduct this webinar, we have Dr. Nayeem Begum, who is very well known to our audience, as she was moderator for our first homeopathy webinar a year ago. She is a professor, PG guide, and head of Department of Practice of Medicine and Research Committee member at Malakareddy Homeopathy Medical College, Kalaburgi, Karnataka State, the city which I belong to. She is evaluator at Advanced Research Wing and member board of study at Rajiv Gandhi University of Health Sciences, Bangalore. She has to her credit several publications. So please mute the audience. Please mute the audience. She has to her credit several publications on research projects, one of them at Central Council of Research in Homeopathy, New Delhi. She is homeopathy consultant at Positive Health and Research Center, Kalaburgi. She has passion to treat variety of patients with homeopathic medicines and enjoys great popularity. She is a reviewer to the textbook of Practice of Medicine by Dr. Kamal Kansal from B. Jain Publishers. Recently, she has presented a paper in an international conference on palliative care with homeopathy in cancer cachexia. Without further ado, please help me welcome Dr. Nayeem with a thunderous virtual applause. The floor is yours, Dr. Nayeem.
Thank you so much, Dr. Anwar Khurshid, sir. Thanks a lot. Assalamu alaikum wa rahmatullahi wa barakatuhu. Namaste, Sat Sri Akal, and a warm good evening to all. Happy Dhanteras, the festival of Diwali, the 5 days festival of lights has begun. A very happy Diwali to all. This is Dr. Nayeem, who has been very warmly introduced by Dr. Anwar Khurshid, sir. Today, I am honored and privileged to virtual platform. First of all, I acknowledge my gratitude of thanks to Dr. Anwar Khurshid, Royal Protocol Physician, King Abdulaziz Medical City National Guards, Riyadh, Saudi Arabia. Vice President, Saudi Indian Healthcare Forum, as he has keen interest in taking Ayush as an integrated model with conventional treatment. I extend my gratitude to Dr. Fawazul Hussain, President, Saudi Indian Healthcare Forum, for his unconditioned support. Today we have participants from various locations and various fields. I begin this auspicious evening with a warm welcome to the speakers, Dr. Piyush Gupta, Dr. Adil Chimthanwala, Dr. Rekha Karnam Srinivas. I extend my welcome to the organizers, Dr. Anwar Khurshid, Dr. Satish Reddy, all the virtual dignitaries and all the virtual participants. A very warm welcome. Homeopathy is the science of therapeutics. The science behind homeopathy is the law of similia and potentization. It's not an alternate medicine. Rather, it's an advanced branch of medicine. According to the World Health Organization, homeopathy is the second largest system of medicine today. In India, homeopathy is the third most popular method of medical treatment after allopathy and Ayurveda. India being global center for homeopathy, during the last 6 years, homeopathy has successfully advanced and developed. Government has encouraged the infrastructure in homeopathic educational institutions. Clinical research in homeopathic trials, drug department, quality standards have all improved. Homeopathic hospitals and dispensaries are increased. Homeopathy has been useful in treatment of many psychosomatic diseases, autoimmune diseases, geriatrics, pediatrics, and many lifestyle diseases. With the safety and scientific validity of homeopathy in treating and preventing global pandemic COVID-19, a revolution in homeopathy begins, which aims to provide competence-based medical education and to improve the quality of homeopathic medical practice, evidence-based homeopathic practice. Latest trends in research are promoted. With these few words, I would like to invite, without further delay, today's speaker, Dr. Piyush Gupta. May I begin with introduction of our first speaker, Dr. Piyush Gupta, sir, BSc, PG Diploma in Industrial Relation and Personal Management, MA LLB, Fellowship in Palliative Care, Fellow National Cancer Institute, USA, Secretary Cancer Aid Society, India, Vice President Cancer Aid Society, USA, Secretary National Association of Palliative Care for Ayush and Integrated Medicine, Member Secretary Cancer Aid Society Ethic Committee, recipient of Jewel of India Award, Master Course on Law and Policy Making to promote cancer prevention and control, World Cancer Campus, Master Course on Cancer Control Planning and Implementation. Sir has many publications, about 100 copyright documents, indicating a series of 25 booklets on different cancers. Clinical trials in 2020 using homeopathic combinations in prophylaxis of viral fever, COVID-19, conducted on 1,700 samples. In 2021, using homeopathic combinations in treatment of fever and respiratory distress due to COVID-19. In 2022, using homeopathic combinations for treatment of musculoskeletal pain. Sir has many honors, awards to his credit. Best Award at Cancer Prevention and National Award for Excellence in NGOs, 2018 at Bangalore. Gaurav Samman Award, 2018 at Mumbai. International NGO Excellence Award, 2018 at Thailand. Cancer Prevention Fellowship Award by National Cancer Institute, USA. Recipient of Jewel of India at New Delhi. Awarded as Vijay Ratna Gold Medalist at New Delhi. It's a great honor to have Dr. Piyush Gupta sir on our virtual platform. Without any further delay, I welcome Dr. Piyush Gupta sir to the floor with a thunder of applause. Thank you.
Thank you, madam. Good afternoon and evening to all the dignitaries. My heartfelt thanks to the organizers and my thanks to all the listeners, audience and friends. Well, as discussed, many of us may be aware about conducting clinical trials and researches, but as I was discussing just before this webinar with other delegates, they were saying that when it comes to doctors of modern medicine, they do not believe us. So believe me, if there are two differences. One is we are doing research in our own system of medicine. And the second one is we are doing a scientific research. Once you are into scientific research, there cannot be anyone who can question your research because his research is also done on the same platform where you are doing the Ayush researches. And that is where I would be talking about the issues. Many of you might be aware of the same. And those who are freshers, I'll be giving them insight about how to conduct clinical trials and researches. And as told, we have done 3 clinical trials in homeopathic combinations very successfully. I'll be covering the last one, which was on musculoskeletal pain. And believe me, the principal investigator of this trial was none other than head of the Department of Anesthesia of Sanjay Gandhi Postgraduate Institute of Medical Sciences, Dr. Anil Agarwal, who is a person of repute not only in the city or state, but entire country when it comes to pain management. So I'll be sharing the presentation. Madam has already told about me a lot of things, so I need not give more introduction. Rather than telling about that I am Secretary of Cancer Aid Society as well as National Association of Palliative Care for Ayush and Integrative Medicine, which has already launched 3 months, 6 months and 1 year courses in palliative care, which are through distance learning. So any one of you, if you are interested in palliative care courses, you can get in touch with me. So I was just sharing the ICMR document on researches, and in the last few lines, they are saying that involving human participants should be conducted in accordance with all the ethical principles described in these guidelines, including side reporting and compensations, etc., as scientific trials are already conducted. And when there are multiple specialties, then the investigators from the respective system should be included in the study as co-investigators. So in our study also, the co-investigator was from homeopathic medicine, and he is one of the faculties in National Homeopathic College, Lucknow, Dr. R.K. Jaiswal. So if we see here, we can see this is the ethical clearance, basically registration by the Central Drug and Research Organization, CDSCO, and Cancer Aid Society Ethics Committee was registered during the COVID menace in 2020. And basically, ever since we have conducted 3 clinical trials, almost 1 clinical trial every year. And I am member secretary of this. So here, when we are talking about the conditions, they are saying that a minimum of 5 members have to clear any clinical trial in case of ethical committee. And these should be medical scientists, clinician. Now the limitation is when we are talking about medical scientists and clinician, these have to be from modern medicine, and as they are not having any provision from Ayush. then legal expert, social scientist, or representative of NGO and layperson. Now, here, if any member of Ayush comes, so they have to come under other categories and not as medical scientist or clinician, because these are not defined within the CDSCO portal. Ethics committee shall have minimum of 7 and maximum of 15 members from medical and non-medical side. So when we are talking about medical scientists and clinicians, they shall possess at least postgraduate qualification in their respective area of specialization and adequate experience in the respective field. And no member of the ethics committee should have a conflict of interest. And if he is having conflict of interest, he should not be part of clearing the clinical trial. For example, I was one of the co-investigators in the trial, so I could not participate in the ethics committee meeting at that time. And the person in ethical committee have to withdraw in any such case. So any change of membership or constitution of the registered ethics committee, again, we have to take the clearance of the CDSCO. And the ethical clearance is given after approval of the protocol from the ethics committee in that case. This is the table how to get an ethics committee registered. So maybe you'll get it from the portal of CDSCO. And the first part is you have to define the ethics committee and formulate the entire things, and it has to be done online. So person who is applying online should get a certificate from the president of the ethics committee. And the ethics committee reviews and accord approval to a clinical trial. They study the protocol, and the format has to be submitted under the table 1, schedule B. So which is studied, and then the proposal is cleared by the ethics committee for any clinical trial. Now, when we are talking about how to get it registered, so this is the sort of screen which we get when after clearance of the trial. Now this has to be registered on the CTRI, Clinical Trial Registry of India. And you can note down the web address ctri.nic.in. You have to create a maybe profile, and then you have to register your clinical trial over here. So this is the main page which you get in CTRI. Once you register it, you give your username, password, login, and then you get the next page.
भाई लास्ट ईयर जो क्वेश्चन भेजे थे वो भेज एक बार और. मेरे पर लास्ट ईयर का क्वेश्चन पेपर तो है, बट लास्ट ईयर तूने जो क्वेश्चंस भेजे थे वो नहीं है, तो जो भेजा था वो कॉपी भेज दे.
So next, when we log into the portal, for example, this is the portal of Cancer Aid Society, which I am managing. Now here you can see that it is saying that registered trials with the status of selected as completed. So we have completed, almost successfully completed 3 trials. Any trial which is undergoing, it will give the details of all the trials. And once you register any trial, and let's say if they do not approve it, so they'll send it back. Then you have to see here that they are saying click here to update trial, send back after review by CTRI. So you have to review that, the objections, and then file it again. And let's say if you want to add a new trial, then you click at this portal, add a new trial. Now, once you file the trial, for example, now this is the approval of registration. And they give a registration number after registering, which is there in their records. So now your trial is approved and you start the research. So this is the email sent from Clinical Trial Registry of India. Now, once you start the trial, you file the trial, and this is the type of screen which you are getting. For example, we have completed 3 clinical trials. Now, if you have to modify, let's say if they want any clarification, then you have to click the modification link. And if you want to see the details of the trial file, then you click on to view the details. So this is how you get the summary of all the trials over here. And it is showing that all the 3 trials which we have already done, they were approved and they have been completed. And this is the sort of screen which we get once the clinical trial is registered. If we see the trial records, this is where you can see it, what all has been filed as per their format. Then when we go into the, maybe because there are so many issues involved, so you get the different headings. And if they have any clarifications, because once you file, now you cannot update until unless they unlock the field. So they'll raise the queries. You cannot change anything once you file your clinical trial. So once they give an objection, they unlock the field, you have to change it. And once again, you finish everything, resubmit, and then they study it and log the field. So this is how the next screen of clinical trial is. In our case, the principal investigator, as I told, was Dr. Anil Agarwal, and co-investigators were one from the homeopathic field. I was also one of the co-investigators, and Dr. Sandeep Puva, he was assistant professor, Department of Anesthesiology, SGPGI MS. So we had two people from modern medicine, two doctors, and one researcher, that was me, and one from Ayush, that is homeopathy. So then the title of my research was using homeopathic combinations for treatment of pain. And the scientific title was evaluating the efficacy of homeopathic combinations for the treatment of musculoskeletal pain. Objectives were evidence-based research for assessment of homeopathic combinations in treating the musculoskeletal pain. The research design and methodology was non-randomized open trial using homeopathic combinations for treatment of musculoskeletal pain. The selection of homeopathic medicines, there were existing homeopathic medicines covered in Materia Medica. Selection of potencies, we used tinctures as well as potentized medicines. The pill size was 20 number for a simple reason that more number of pills can be given to the patients and they need not come again and again for getting the pills. Selection of dosage was 3 pills at a time. Frequency was 4 hourly. And the day's assessment started after 1 week, and it was to be continued and reviewed successively every week for a month. So this was how it was designed. Then interventional medicines which were used were, you are already familiar with these medicines, combinations of Simicifuga racemosa, Naphyllum, Hypericum, Ginkgo biloba, Symphytum, Calcarea fos, Rustox, Brynia, Naxvomica, Arnica, Magphos, Colocynth, Colchicum, Rhododendron, Strontium, Stannum, and Theocinamum. Now this is the clinical trial summary. The baseline characteristics, if we see, there were overall 35 responses, and 2 were beyond the age specifications, so they were not included in the trial. And we see that less than 18 years, these 2 people were less than 18 years, and 18 to 45 years, they were almost 51% of the clinical trial data was into that. And 45 to 60 years, you can see 28% patients were there, and over 60 years, 14% patients were there. And here 2 female patients were out of inclusion criteria because they were less than 18 years, 17 female patients and 16 male patients were there. Now, when we are talking about the location of pain, so 13, that means 37.1% maximum patients were suffering from pain of the ankle, followed by 11 patients, 31.4% patients having complaints of knee and low back. 25.7% patients suffered from pain of elbows, followed by 20% each of head and back of the neck. 11.4% patients had pain of the shoulder and fingers, and each followed by 8.6% each of ribs and hip. Now, type of pain, we were talking about burning, radiating, and constant. So 68.6% patient had constant pain, 25.7 had radiating pain, and 14.3% had burning pain. So we all know that when we are talking about burning and radiating pain, these are pains of the due to nerves. Now, when we talk about intensity of pain out of 10, so when we are measuring the pain, we measure it on a 10-point scale, 0 with no pain and 10 the maximum possible pain. And we ask the patients how much pain they have in the initial duration, and subsequently what is the reduction of pain on the 10-point scale. So we can either measure it in percentage or rupee scale, or maybe 10-point scale. So 34.3% each had moderate and severe pain, followed by 22.9%. They had the worst, and 8.6% was mild. Now, result is that all of them, they are saying that they were satisfied. Now, 100% people being satisfied with homeopathic combinations speaks a volume. None of them was dissatisfied. So after 1 week, we see the response. So we can see that 37.1% patients had 50 to 75% relief. And this is a very big number, getting 50% relief within a week, followed by 31.4% getting 75 to 100% relief. Now, again, 100% relief they are getting within a week itself. And 22.9% patient getting 25 or 50% relief. So when we are talking about less than 50% relief, only 22.9% are getting almost less than 50% relief. And only 3 patients were having less than 25% relief. After 2 weeks, we see that 57.1% patients, they had almost 75 to 100% relief, followed by 34.3%, and they had 75 to 50% relief. And only 3 patients, that is 8.6%, they were having less than 25% relief. Response after 3 weeks, if we see, now most of the patients were cured and they stopped medication after 2 weeks. Hence, only 12 patients continued, out of which 7 got 75% to 100% relief. 2 each got 50 to 75% relief and 25 to 50% relief. And only 1 patient reported less than 25% relief. What is the response after 4 weeks? Let us study. Only 9 patients did not get full relief and continued medicine beyond 3 weeks. So that is a huge number of patients getting relief within 3 weeks. And most of them were chronic patients, out of which 5 got 75 to 100% relief, 2 got 50 to 75% relief, and 1 each reported 25 to 50% and less than 25% relief. So this is the statistics. Only 9 people who did not get relief within 3 weeks, they continued for the 4th week treatment. So bearing 4 patients, all the patients reported 75 to 100% relief after 4 weeks. And thus we can say that the trial was very, very successful. And if you see the comments, they are saying that backache was gone, excellent, need more medicine, very good, excellent. Initially the pain recurred. Actually, some of them, they stopped taking medicine once they got the relief. So pain recurred after that, then they start taking the relief once again. They started taking the medicine again. And one of the doctors of modern medicine and pain management, Dr. Geeta Joshi. Now, she was in Haridwar and we were into the meeting of the governing body. I can just share the experience. And she was limping. So I said, do you need some medicine? So she said, fine, I'll take it. So I gave this combination. I was having it. I gave it to her. And within the next 3 hours, when we met for the dinner, she said that I had taken the medicine and I walked for 3 kilometers without any pain in my leg. So now you see how fast it is working, just like any other analgesic of allopathy. And she walked down. However, next day she had lassi and she got her stomach upset. So she is writing sterility of medicine is a question. But afterwards, maybe after 2-3 weeks, when she reached Gujarat, she had pain again. She is having osteoarthritis in her knee, and she took the medicine once again, and again she got instant relief. So then I discussed that, what about sterility now? She said, no, it is fine. It did not occur again. So outcome was good. So I'm writing it over here also that 18 patients had given encouraging remarks. Others did not give any remark. And I was talking about Dr. Geeta Joshi, and she also had used this medicine for herself. Now, when we are talking about the primary objective, which was improvement in pain relief in patients suffering from chronic musculoskeletal pain, it was met successfully, and we have already covered it at length. The secondary objective was improvement in quality of life, reduction in dose of rescue analgesic, and reporting of any adverse effect during the study period. Now, secondary objective was successfully addressed as the patients did not take any allopathic medicine for pain relief when they were taking this homeopathic combination. And there were no serious adverse events or adverse events associated in this trial. Thank you. Thank you for giving me this opportunity to speak to you.
Thank you, Dr. Piyush Gupta, sir. It's very nice to hear about the success of homeopathy with so results at a rapid rate. Thank you so much. We are very fortunate to have you here as a speaker. So you have enlightened us with the latest trends in research, evidence-based homeopathy, and of course, prophylaxis with combinations in preventing musculoskeletal pain. Thank you, sir. Holistic healthcare remains. Thank you. Holistic healthcare remains a very big attraction. Best of the doctors are moving towards the homeopathy. There is a need to go forward from a stressful life to a stress-free life. Good health with homeopathy is all a dream come cherished. The floor is delighted to welcome our next speaker, Dr. Adil Chimtanwala, sir, globally renowned homeopath and cardiologist, with his topic of today, Scope of Homeopathy in Modern Science. May I be honored to introduce Dr. Adil Chimtanwala, sir. Sir belongs to the 4th generation of reputed family of Chimtanwala, who is devoted to the service of homeopathy for more than 105 years. Sir is basically MBBS from Nagpur University with great honors. Completed BHMS from Maharashtra University of Health Sciences, Nasik, being college topper for all the 4 years. DNB Diplomate of National Board of Examinations in Internal Medicine, New Delhi, and Government Medical College and Hospital, Nagpur. MD Homeopathy in Practice of Medicine from DKMM Homeopathic Medical College, Dr. Babasaheb Ambedkar Marathwada University, Aurangabad. Certified as Professional Competence in Information Sciences from APEC Computer Education. With Dr. Fatima Chimtanwala, a better half and professional associate, sir is a consultant at Shad Homeopathic Heart Care Center, Nagpur, Adil Homeo Heart Care Center, Hanimanian Hall, Nagpur, Orange City Hospital and Research Institute, Nagpur, Ayush Holistic Healing Center at Mumbai, where he visits the first Sunday of the month, and Ayushman Homeopathic Clinic at Bangalore, where he visits once in 3 months. Sir is head of the Department of Medicine and Cardiology, Postgraduate School of Homeopathy, Secretary to the National Academy of Homeopathy, India, Director, Diploma in Homeopathic Cardiology, a 2-year course, Clinical Secretary, Organizer, Participant, Speaker, monthly clinical meetings, workshops, journal clubs, case discussions, and drug projects. These all are carried out. Sir's academic dispensation conducts UG classes in homeo and allied subject for students, conducts PG residential training seminars, the principles and practice of homeopathy for graduate teachers and research scholars, conducts homeopathic workshops, conducts awareness classes for laymen, conducts internship program for national as well as international students at their home countries like in Australia and Malaysia. To present a few contributions, Sir had thesis clinico-angiographic profile in young patients of ischemic heart disease, thesis for Diplomate of National Board of Examination in Internal Medicine, New Delhi. Scope of homeopathy in angina pectoris was the thesis for MD Homeopathy from Baba Saheb Ambedkar, Marathwada University, Aurangabad. Sir has various publications, articles to his credit. To name a few, scope of homeopathy in cardiac cases, can myocardial infarction be managed with homeopathy, evolution of homeopathy from Hahnemann to Kanjilal, arrhythmias and homeopathy. Books published along with Father Dr. Qasim Chintanwala, to name a few, The Calcutta School of Homeopathy, As I Perceive and Practice, Skin, Mirror of Sick Economy, Homeopathy Case Taking and Management, No Source, Multi-Polycrest Remedies, Textbook of Homeopathic Cardiology. Sir has many research projects to his credit, Scope and Limitations of Homeopathy in Cardiological Disorders, a 7-year clinical cum statistical research, statistical report on scope and limitations of homeopathy in management of cancer and its appendages, reproving of drugs. Sir has been bestowed with many certificates and awards. To name a few, recipient of Dr. Hahnemann Award for his excellence in homeopathy, Avantika Dhanavantri Award by Chikitsa Sansar at Ujjain, prestigious Homeoshri for his excellence in chosen field of medicine from Lucknow. Recently received Star of Homeopathy with his father, Dr. Qasim Chintanwala at University of West London, United Kingdom. It's a great honor to be with you, sir, associated in this virtual platform. With a great, biggest Diwali dhamaka to have Dr. Adil sir with us. Without wasting any time, I invite you with the thunder of applause, sir. Thank you.
Ladies and gentlemen, thank you so much. At the outset, Saudi Indian Forum, Health Forum, I would like to congratulate on such a wonderful initiative. In fact, only hardly 3 months ago, I visited Jeddah and trained allopaths, people from modern medicine in homeopathy. It was a fantastic 40 people attended, and I had a chance to train them in the works of homeopathy. And the initial lecture, the first lecture, in fact, was the same lecture that I'm giving now, scope of homeopathy. Now, people from I have done my MBBS, DMB medicine, I have done PhD in homeopathy. So people always ask me, particularly allopaths, my friends and my colleagues, how does homeopathy act, whether it really acts or not. So it's high time now that people accept, and I will be giving you 2 cases to prove that homeopathy is evidence-based. Let's start, and I've been given 30 minutes. Let's see if I can finish off in 30 minutes. So I'll share relevant things. Now this lecture basically was from for people who are, they know homeopathy, but they don't know the scope of homeopathy. And although not completely correct homeopathically, but it will give a fair idea of scope of homeopathy in modern times. Still, because of the lack of time, I'll be lacking, but I'll be focusing more on cardiology. So let's start. So homeopathy has got ample scope beyond doubts in emergencies, because day in and day out, I am attached to at least 5 ICCUs of my city. Emergencies, acute symptom or symptom syndromes, chronic symptom or symptom syndromes, gross pathological states where people have given up, epidemics, and a new concept called as homeopathic vaccinations, which we have introduced since past 15 years and we are working. And all these states, homeopathy has got different roles to play. In fact, the limitation is more of a homeopath rather than the pathy that is homeopathy. Let's take a glance of how many systems we can cover. Of course, I don't think I'll be able to cover lots, but the diseases of upper respiratory tract, I have sub-labeled it as a curable diseases and palliative diseases. Now, let us first see that homeopathy, first of all, is a highly individualistic science. So, labeling them just by diseases is actually not justifying homeopathy, but still to explain it to lay people or to people of modern medicine how homeopathy acts, because they don't understand the individualistic part. That's why this labeling is there. So curable, allergic, infectious rhinitis, nasal polyps, turbinate, hypertrophy, they are curable. You don't need surgery at all. Hardly 3 to 5 months of medicines, proper constitutional medicine or a nosode, and you can have a cure. And when I say cure, I say Hahnemannian cure. That means the disease is completely exterminated and completely uprooted from the constitution. Sinusitis, any sort of kind of sinusitis, tonsillitis, tonsillar hypertrophy, quinsy, calculi, salivary gland disorders, name it, Warthin gland tumors, etc. Laryngitis, laryngeal nodules, pharyngitis, acute suppurative and chronic suppurative otitis media. These are all completely curable with homeopathy. A proper approach, proper medicines, proper repetition, and bang, cure. No need for surgeries or even modern, any other system of medicine. Palliative mucormycosis. We have seen lots and lots of cases of mucormycosis nowadays with the advent of this COVID-19 and post-COVID complications. Mucormycosis was stopped, and innumerable cases of mucormycosis have been helped with homeopathy. Cancers of the upper respiratory tract, we can have palliative approach. In the initial stage, we can even cure, but in the late stages, like stage 2, 3, sorry, stage 3 and 4, they are palliative. But still, homeopathy can do. Even if the patient has undergone surgery, if there's a relapse or meds, palliative can be done. Diseases of the lower respiratory tract, asthma, chronic bronchitis, and pneumonia are 100% curable in most cases. Palliative, chronic obstructive airway disease, people suffering from years end together, they don't need to suffer. They don't need to keep on taking the puffs and steroids. Homeopathy can do the job. Pleural effusions, bronchiectasis, emphysema, lung cancer, interstitial lung disease, or post-COVID sequelae. We have got innumerable respiratory complications of this COVID. And in fact, like diabetes, COVIDology is now a separate branch of medicine now, because it has changed a perspective of looking at diseases. So all these can be palliated with homeopathy very effectively, and we have got evidence, innumerable evidence for that, supporting that. Disease of the oropharynx, curable. Dental caries, pyorrhea, tooth pain. In fact, one of my students is a homeopathic dentist. She practices exclusively homeopathic dentistry. She has got a dental chair, and she does all the procedures what a dentist does, and gives homeopathy for the post-dental treatment. How fantastic about that? Gingivitis, CA tongue in the early stages, CA of the palate, including submucous fibrosis, leuco and erythroplakia, aphthy of whatever reason they may be and whatever duration they may be, they are 100% curable. Palliative in cancer tongue late stages, or cancer of the palate in the late stages, paralysis of the tongue either because of multiple sclerosis or ALS. Incurable, we cannot cure obviously cleft lip and cleft palate, so that's a surgical domain. Pushing forward is disease of the stomach and esophagus, achalasia cardia, functional dysphagia, gastroesophageal reflux disease, gastritis, H. pylori also are completely curable in our setup. We have effective palliative medicines for cancer of the esophagus and the stomach, with or without metastasis, and diffuse esophageal spasm. Incurable Barrett's esophagus, esophageal atresia, esophageal diverticula, and hiatus hernia, where homeopathy has very, very little scope, if any, and that too for a very short time. Intestine, curable IBS. I think irritable bowel syndrome is a psychosomatic disease. So if you talk with the patient, counsel the patient well, give the constitutional drug, bang on, IBS is curable. You don't need much time. Gastroenteritis infections, be it typhoid or tuberculosis, I'm talking about extreme, and acute like shigellosis and cholera, which we hardly see nowadays, but still we see they are completely curable. In fact, homeopathy came to India for treating cholera sicca of Maharana Pratap. Maharana Pratap was passing diarrhea and he was not being cured by the local medicines. He invited a German physician, Honnenberger, who gave him a particular homeopathic remedy, and he was cured of that. And that is how homeopathy got entry into India way back from Maharana Pratap's time, and still it is there. It's very flourishing. In fact, India is the home of most homeopaths in the world, most homeopathic colleges in the world, most homeopathic manufacturing units in the world, and most homeopathic consumers in the world. It was because of this gastroenteritis. Worms and wormidiathesis, diarrhea, constipation, hemorrhoids, but not prolapse, not grade 4 hemorrhoids. Fistula and fissure in ano and abscess, they are very, very routinely seen in most of the Asian population, even abroad, European populations, and they are completely curable with homeopathy. Palliative cancer, cancer of either of the colon, small intestine, and the rectum and sigmoid junction in the early stages. We have got innumerable evidence for supporting that. Celiac disease, this is a very, very common disease, not in India, but outside India. And particularly in Jeddah, I've got about 17 to 20 patients of celiac disease, malabsorption, interstitial ischemia, ulcerative colitis, Crohn's disease, cancer of the lactose intolerance. All these have got effective place. We cannot cure polyps, diverticulitis, intussusception, volvulus, and gangrene. Liver diseases, hepatitis A and E are completely curable. Palliative fatty liver, non-alcoholic steatohepatitis, hepatitis B, cirrhosis. N number of patients.
म्यूट करिए प्लीज, म्यूट करिए अपना.
Sorry. So fatty liver.
Dr. Aisha.
Fatty liver, non-alcoholic steatohepatitis, hepatitis B, cirrhosis and portal hypertension, cancer of the liver, cancer of the bile duct, cancer, gallbladder, and gallstones. All these have got effective medicines, palliative medicines in homeopathy. In fact, gallstones less than 3 millimeters, they do not need surgery. If under proper homeopathic care, lots and lots of them go away. Incurable liver cell failure. Of course, we cannot cure liver cell failure and Gilbert syndrome, primary biliary cirrhosis, and autoimmune hepatitis, hemochromatosis, and Wilson's disease. But then we can give them a very good life with homeopathy because they are as it is incurable in any system of medicine. Neurological diseases, migraine, Bell's palsy, neuralgias like trigeminal, facial, or sciatica, and transient ischemic attack are nearly curable with homeopathy. A proper approach needs to be adopted. Incurable cerebral palsy, but we have got, like, my wife is a homeopathic pediatrician, and she handles cases of cerebral palsy, ADHD, autism, with it's fantastic to see how homeopathy can offer help even in such disorders which they are incurable. Neurofibromatosis, obviously, we cannot cure them, but at least we can retard the progress of those neurofibromas. Brain or spinal cord injury and carpal tunnel syndrome. We have got lots of patients who have undergone brain or spinal cord injury and they now want to get rehabilitation. So homeopathy may not be able to cure them, but you can give them a good rehabilitation. Carpal tunnel syndrome, several cases of carpal tunnel syndrome we have got, where again rehabilitation is good, pain management is better, but cannot cure them. Palliations, infections. Practically all infections meningitis, encephalitis, tuberculosis, neurocystic fantastic medicines. And we have got several evidence-based cases of encephalitis and tuberculosis actually been completely cured with homeopathy. So apart from palliation, if the patient opts early homeopathic treatment, we can do many things for them. Degenerative diseases like Parkinson's, multiple sclerosis, Alzheimer's disease, motor neuron disease. This is fast increasing. Many patients. Hardly 10 years or 20 years ago, there were very few MND patients. In fact, the diagnosis was not done. But very few patients. Nowadays, in the past 10 years, we have seen a steep rise of MNDs, motor neuron disease in India, multiple sclerosis in India. And drugs like Black Mamba, drugs like Causticum, simple drugs like Latharis, Curare, Strychnine, they offer wonderful hope to these patients of multiple sclerosis, not only prolonging their life, but rehabilitating them. Of course, physiotherapy here is needed, but then physiotherapy is not much effective in MS and MNDs. Epilepsy, cervical spondylosis. Lots of people come for epilepsy, epilepsy, grand mal epilepsy and all. They want to reduce so many allopathic drugs they have been taking since more than 3 years, 10 years, 15 years. They now want to stop, shift over to homeopathy, which is very much possible if a correct approach is adopted. But in all cases, no, I may not say that. In few cases, very well, yes. Cervical spondylosis has become the order of the day because laptops and mobiles and all have come very driving long distances, and that leads to cervical spondylosis. People keep on doing MRIs and CTs and to just see the osteophytes, but hardly painkillers are given. Ultimately, the whole scope comes to physiotherapy, but in homeopathy, at least 20, 25, 30 drugs have well proved, and they can relax not only the muscles, but the formication, what happens, the tingling and the numbness and the pain, and cervical spondylosis can nearly be cured in many patients. Peripheral neuropathy, n number of reasons for peripheral neuropathy, right from vitamin B12 deficiency to diabetes and hypertension and so on and so forth. We have got lots of reasons. Many patients we feel we have where hypertension is well controlled, diabetes is well controlled, I mean sugar levels are controlled, and yet peripheral neuropathy is there. Drugs like medurinum, picric acid, and likes, they have very good scope in peripheral neuropathy. Guillain-Barré syndrome is, as it is curable, very expensive method of treatment in modern medicine. I don't know about other systems of medicine, but in homeopathy, very few drugs like conium and vipera have a great scope in Guillain-Barré syndrome. We run a hospital and we run an ICU as well. And I'm attached, as I told you, that many, and we have seen Guillain-Barré syndrome responding to homeopathy quite fast. Brain and spinal cord tumors, yes. Schwannomas, yes. Strokes and the sequelae. Once the paralysis has taken place, hemiplegia or hemiparesis, then slowly and steadily we can bring back the patient, rehabilitate the patient with homeopathy. Not alone with homeopathy, but homeopathy plus occupational therapy, homeopathy plus physiotherapy. Then we have an area called chorea, tremors, cerebellar diseases, abnormal movements. Now these have got very few drugs in other systems of medicine, whereas in homeopathy, at least 10 to 15 medicines have been very well and very frequently used. One of the drugs like Mygale gives very good results. A spider remedy gives fantastic results, and actually you can see the tremors being decreased. Hardly takes 15 to 20 days, and the next time the patient comes in 15 days or 20 days, and this patient will report, "Doctor, thank you very much. 50% reduction is taken, but still it is there. Slowly and steadily, gradually, 3-6 months, and the thing is controlled." Eye disorders, conjunctivitis, uveitis, wherever the itis, inflammation is there, homeopathy has 100% role. Conjunctivitis, uveitis, stye, blepharitis or spasm, blepharospasm, we have got fantastic medicines. Glaucoma is a very common disorder in India, of course, and abroad. We need to give a long-term treatment, but we may not be able to cure both open and narrow angle and closed narrow and open angle glaucoma. Both have got palliative treatment in homeopathy. Diabetic and hypertensive retinopathy, we can actually, drugs like carcinosin, medurinum, cipilinum, they retard the progress of these retinopathies. And at least, suppose if it is the patients detected in grade 1 or grade 2, we may not let them progress to grade 3 and grade 4. A. B. If there's a repeated cotton wool spots and hemorrhages in the eye, we can stop them by drugs like phosphorus and arnica. Drugs like ptosis, very common, either myasthenia gravis or ptosis independently because of many reasons. We have drugs like causticum and gelsemium, which and even upas, where ptosis respond. Dry eyes, floaters, amblyopia, which is called lazy eye, all have got effective palliative scope in homeopathy. Of course, we cannot cure refractive errors. Many people come to us, doctor, my child is 20 years old, we have got thick glasses. Can you remove those glasses? No, please don't. If you want to take lenses, that's good, but homeopathy is not good. Yeah, of course, if a child comes to us at the age of say 10, 11 and 12 years, we can try macular degeneration and cataract. Yes, people keep on putting this eye drops, cineraria eye drops and other eye drops, but cataract, of course, is an old age phenomena. It's not a disease as such. So yes, we may delay the surgery, but we cannot cure it. Strabismus, like the squint, optic nerve disease, retinitis pigmentosa, or retinoblastoma, which is one of our fastest growing malignancies of the eye, central retinal vein occlusion, coloboma. Although drugs like tabacum, aconite are there for central retinal vein occlusion, but on clinical arena, we don't see very fast results. In fact, there are many other options available in other pathies. So I think the patient should go there rather than opting for homeopathy in such cases. Color blindness obviously is incurable. Detachments of retina and vitreous, but recurrent detachments we can prevent with homeopathic medicines. But once the retina is detached or the vitreous is detached, we need a surgical intervention. Ear diseases, earache, acute suppurative otitis media, chronic suppurative otitis media, and ear wax are nearly curable. I've hardly ever seen a patient who has to undergo surgery or any other medicines once they have come to homeopathy for such disorders. But tinnitus, many people are suffering from tinnitus. We can give them palliation, but till the patient is taking homeopathic drugs, the patient is free from tinnitus. Conductive deafness and acoustic neuroma, we can palliate in some cases, cure, but not all cases. And we cannot cure cochlear disease or sensorineural deafness. A very common, in fact, most common, just now a previous speaker presented, we can cure chronic fatigue syndrome, which is the most prominent urban as well as rural rheumatic disease, we can call it, as chronic fatigue syndrome. There's pain everywhere. It's not pain, in fact, there's fatigue everywhere. After a long day or a short day, after a long drive or a short drive, the person is unable to function, feels exhausted mentally as well as physically. And this goes on for years together. Proper homeopathic treatment and you can cure them. You can cure myalgias, fasciitis, gout, tennis elbow, frozen shoulder, rheumatic arthritis. Of course, gout depends on which stage the patient has come. Not all stages of gout are curable. Early stage, yes, curable. Palliative, osteoarthritis. Osteoarthritis again is a degenerative disease. It's a aging process. You cannot cure aging process, but you can halt the aging process. Drugs like osteoarthritic nosode, rheumatoid arthritic nosode, and various other drugs have come into foreplay, and we can actually give a fantastic result. Rheumatoid arthritis, even juvenile rheumatoid arthritis, Still's disease, with the patients who are dependent on steroids or on methotrexate, we can stop those drugs, slowly and steadily taper them off and shift them completely to homeopathy. Take for 3 to 4 months, rehabilitate. Initially, when I was doing my MBBS and MD, burnt out cases of rheumatoid arthritis, like people whose fingers have clawed, I thought that they would never respond. The only hope is surgery or at the most physiotherapy, and for lifelong they have to keep. But when we started using drugs like psychotic co, which is the bowel nosode, we have had immense benefit. And I could see the patients, along with the first physiotherapy, the patient's fingers, which initially curled, now have straightened out. It's really fantastic to see such results when you actually see them in clinics. So ankylosing spondylitis, initially if you have got a bamboo spine, the patient cannot move, and with the simple drugs like Briannia or Rustox or strychnine, the patient starts flexibility of the neck and the flexibility of the back. Although on the CT scan or an MRI, you will have the same results, but clinically the patient becomes much better. Patient's lifestyle improves. I believe this is if homeopathy can give this without steroids and without methotrexate and without all these other drugs like HCQs and all. I should salute homeopathy because it does. Spondylitis, spondylosis also. Of course, that's psoriatic arthritis. Psoriatic arthritis is very common. Many people may get only one small patch of psoriasis, but very prominent psoriatic arthropathy or psoriatic arthritis. In fact, psoriatic arthritis and rheumatoid arthritis is very, very difficult to differentiate clinically because they have the same features: early morning stiffness, small joints affected, neck joints affected. But yes, we can take care of that too. Infectious arthritis like tuberculosis, very common in India. Gonococcal, nowadays very rare. Gonococcal arthritis, syphilitic arthritis, practically I've hardly seen a case. I mean, in early days of my study, I used to see syphilitic arthritis, but now it's not there. Chikungunya, very, very common, particularly in diabetics. Drugs like Eupatorin perf, Euphorbinum, Ruta, Calcarea flor, excellent results. Calcaneal spur. So palliation, yes, 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 homeopathy should be taken first. And the beauty of homeopathy, even if you give them like mother tinctures or 1x, 2x, 3x, if you give them long term for 3 months, 6 months, it does not cause proving, it does not cause any bad effects, and the patient can take. Patient can also take it with other systems of medicine, with keeping a gap apart. Skin is one very, very big area where I could not cover because of lack of time. I did not take the slide. Skin and cancers are the in thing today. Allergies, every sort of allergies of the skin, malignancies of the skin. We have I mean, there's a separate department at our center, skin and allergies. Both are doing exceptionally well. And we have seen so many evidence-based cases every time we present it in national, international fora. I mean, it's applauded. So there are plenty many there. I'm talking about autoimmune disease. Only alopecia areata and lichen planus are curable. Otherwise, most of the autoimmune disease, we can only support them, palliate them. We can withdraw the steroids, we can withdraw the other immunosuppressing agents and give them a better life. SLE patients, for example, they have got repeated abortions. We can give the medicines, right, drugs like cipilinum, stop their tendency of abortions, and help the female to deliver a proper baby, a good baby, healthy baby. Same with scleroderma, rheumatoid arthritis, and different names: Hashimoto's thyroiditis, interstitial cystitis, acute glomerulonephritis. Acute glomerulonephritis, they run from place A to place B, and for years together they keep on suffering. They do kidney biopsy time and again, and big diagnosis like FSGN, etc. is given. But ultimately, you ask the patient is so sad. Give them a proper homeopathic remedy, simple drugs like arsenic or apocyinum or apis or cantharis, and you see the proteinuria being decreased, and you can see the bad effects of steroids that also can be decreased. I think homeopathy is doing a great job for such people. Endometriosis, Sjogren's syndrome, ulcerative colitis, myasthenia, sarcoidosis, so on and so forth. Of course, hepatitis like primary biliary cirrhosis, IDDM, we have got limited scope. We cannot withdraw insulin, and that is criminal. If a homeopath says stop insulin to IDM patients, even after giving constitutive therapy, we have seen that you can decrease the dose of insulin, or at the most, suppose that the patient is taking 48 units now, we can decrease it to keep it to 48 and may not increase. We can nullify or decrease the complications of IDM patients, early complications. That is possible. But total absence of insulin, I don't think it's possible. It is not in my practice. Aplastic anemia, no. Hypoplastic anemia, you have drugs like TNT, X-ray, vanadium, but they help. They cannot cure. Autoimmune hemolytic anemia, thalassemia, sickle cell disease, etc. No. Palliative anemia, we can help, but then the ferrum phos or ferrum met cannot replace the original iron. We don't have any parallel drugs for vitamin B12 or folic acid. You have to give them folic acid deficiency. You have to give them folic acid. If it's B12 deficiency, you have to give them for B12. Hemophilia, many cases of hemophilia. In fact, the whole family in Saudi I've got, and the entire family, it's called a royal disease and hemophilia. And you'll not believe, we have nowadays the bleeding, all these people who are under homeopathic care or hemophiliacs, their bleeding time, it has increased. The clotting time has decreased tremendously with homeopathy, and now they're able to control bleeding very fast. Leukocytosis, polycythemia vera, whose hemoglobin comes to 17, 18, 19, and 20. They have to keep on donating blood. We have drugs like benzene, we have drugs like carcinosin, which can stop this clotting. We have drugs like bothrops, which can stop the clotting and the complications which go along with polycythemia vera, although we may not be able to cure polycythemia vera. Sickle cell disease, sickle cell crisis. In fact, the place where I stay, Nagpur, India, it is the capital of sickle cell disease in India. And every other household, we have got sickle cell disease. The reasons are plenty. And so day in and day out, we have got sickle cell units, and homeopathy has been an integral part, even in medical colleges. I'm talking about allopathic medical colleges. They also take help of homeopathy. And I'm so glad that we have an interplay of modern medicine asking help with homeopathy, and we asking help for them, and combined management for sickle cell disease and sickle cell crisis. Thalassemia, same way. These people keep on needing blood every 18 days or 20 days. If you can increase the length of time to 30 days, I think homeopathy has a very, very important role to play for thalassemia. Von Willebrand's disease and leukemia. Leukemias, I believe a modern medicine does have an upper hand because they have got fantastic medicine. In fact, for them, leukemia is curable, as we say. Homeopathy has got drugs, but not for everyone. I'm talking about different types of leukemia, acute or chronic myeloid or lymphoid type of leukemia, and the other subtypes of leukemias. So now coming to my main topic, because I'm a homeopathic cardiologist, I practice exclusively homeopathic cardiology. This was all because I'm in a hospital where all of us, other specialties are there. My father is a homeopathic oncologist, a cancer specialist. My mother is an obstetrician, a gynecologist, homeopathic obstetrician, gynecologist. My wife is a pediatrician, and so on and so forth. That's why I've collected data from there and presented. But now this is my arena. So we started way back in 1997, and from 97 till 2022, we have been working exclusively in homeopathic cardiology. That's me and my team. So homeopathy has got effective scope. I'll be showing in two cases. Ischemic heart disease, angina, both stable and unstable, but not acute myocardial infarction. Acute myocardial infarction, we don't have a good scope. Where you need to thrombolize the patient, you need to thrombolize the patient. Homeopathy cannot be substituted for that. Hypertensive state and complications. It's a wrong notion that every hypertensive needs a lifelong antihypertensive therapy. No. If a correct homeopathic medicine is given, constitutional therapy is given, it takes maximum 2 or 3 years, and hypertension can be completely cured. Its complications can be very well covered. And the complications include all nephropathy, retinopathy, hypertensive, cardiopathy, and so on and so forth. Valvular heart disease, we have got effective palliative therapy. You don't need to always undergo surgeries. Arrhythmias, supraventricular arrhythmias can be very well taken care of, but not ventricular tachycardias, no. Complete heart block, we have got several patients now. At least I can present about 40 to 45 patients who were advised pacemakers, and they are not on pacemakers anymore. And it's been 5 to 7 years of subsequent continuous following, and they are in homeopathy, and they're doing very well without pacemaker, only on homeopathy. Congestive heart failure, now gone are the times that every time you need to hospitalize the patient. A day in and day out, and under OPDs and IPDs, we manage congestive heart failure very effectively. Congenital heart disease, not all congenital heart disease needs surgery. Of course, that does not mean that we can cure congenital heart disease, but we can maintain the pressure. Now, for example, a VSD is there. And so there are two chambers being separated by the VSD, the left and right ventricle. So when a VSD is ventricular septal defect. So whenever there's a defect, there's a pressure gradient from right to left to right or right to left. Homeopathy can effectively balance that pressure gradient. We have got specific drugs like Convalerium majalis. We have got drugs like Strophanthus, Adonis-War, and they are just not names. For 22 years, we have been studying them. N number of papers have been published in peer-reviewed journals, and we have got enough evidence to prove that they act. Not only mother tinctures, but even potencies. Infections leading to myoendocarditis or pericarditis. In the COVID times, we saw a lot of patients of not only ischemic heart disease, because COVID is a cardiovascular disease, mind you. It's not a respiratory disease. So it's a blood disease affecting the RBCs. So we saw a lot of myocarditis patients, endocarditis patients, pericarditis patients who were given steroids and other drugs, but were not responding. Homeopathy intervened, and we could give them a better life. Heart affected because of other disease, like diabetes affecting heart, autoimmune diseases affecting the heart or the cardiovascular system, certain drugs like anti-cancer drugs and causing heart failure. We have got drugs. In fact, just now I'm following a patient since past 5 years. was referred to me by a allopathic cardiologist, and she had got heart failure. Her pumping capacity was only 10%. She was a known case of cancer breast. She was taking daunorubicin as an allopathic drug as a chemotherapy for cancer breast. Because of that daunorubicin, she developed cardiomyopathy, and ultimately they could not give her anything. Her BP used to always stay low, so they could not give her Lasix as well. That's why she was referred to homeopathy. For past 5 years, she's a simple middle school teacher, and she's doing so well with homeopathy. And we did not need much drugs. I am a single dose prescriber, so I don't keep prescribing all these patents and all. Single dose is enough for me. Sometimes a patient comes with single symptoms like only breathlessness without cause, cough, bleeding from natural orifices, choking, palpitation, syncope, shock. All these independently can manage with homeopathy. So at the National Academy of Homeopathy India, where I'm speaking from, we have established a full-fledged setup at Nagpur, the place where I stay, Mumbai, Bangalore, dedicated to service cardiac patients with homeopathy. We have got tie-ups with different ICCUs. It is not that the patient comes to us and requests, doctor, my patient is admitted, please, can you come and visit it silently? I said, no, let the doctor officially call me, and I will write it down on his, on the letter, at the notes, the daily rounds. That should be there. So when you go, you should go as a proper consultant, as a homeopathic consultant, and they also respect you, and you also go with this. And mind you, modern medicine people are very broad-minded. When it comes, they only need to be sure that it's not fake, it's evidence-based. Yes, we can show them evidence. Many short and long clinical studies and publications. I mean, in 22 years, n number of studies, I don't even remember the count. Reproved 32 homeopathic drugs, especially in cardiac sphere. All homeopathic drugs have been proved in Western countries like UK and US and other countries. Unfortunately, India being a hub of homeopathic medicines, very, very few drugs have been proved here. But we, since past 2004 till 2022, every single year, barring the 2 years, that is 2020 and 2021, every year we prove 2 drugs. We reprove, in fact, 2 drugs and lots and their scope in cardiology as well as other systems of medicine. Several new rubrics have been introduced. Rubrics are nothing but symptoms which are in another language, a homeopathic language, and are kept in repertory. We have published 10 books, innumerable articles, case studies in national and international peer-reviewed journals. Probably for the first time in the history of homeopathy, we have deciphered specific drugs for specific ECG and echocardiographic changes. Like if a patient says, doctor, I have got diastolic dysfunction. Do you have a drug? Yes, we have a drug for that. We have got chamber hypertrophy, left ventricle or right ventricle, left atrium or right atrium has enlarged. Do you have specific drugs for that? Yes, in homeopathy we have got. If the pumping capacity, ejection fraction is reduced, do you have drugs to increase that? Yes, we have got that. The detailed miasmatic correlation of cardiac pathologies, which was not done earlier, established standard cardiac protocols for managing cardiac emergencies like angina, infarcts, congestive cardiac failures. Because when you want to run an ICCU or homeopathic ICCU, you need to follow protocols. We just cannot come and wear whims and fancies. Although homeopathy is individualized, strictly individualized, yes, but to train the next generation, I need to give up protocols. They may be partial simillimums, but then this is how things run. Modern medicine has been successful in handling emergency patients solely because of uniformity of protocol formation, whether it is Brazil, whether it is America, whether it is Jeddah, whether it is India, wherever, the protocols remain same, and that is why the ease of management becomes easier. Probably one of the first clinical setups in the country to cater to veterinary patients suffering from cardiac disorders. So it is not only human beings, veterinary patients also suffer from cardiac disorders, and we have got so many, like Thursday is our OPD for vet clinic, and we have got not only dogs suffering from congestive cardiac failure, and cattle and the horses and all, a wide variety of patients. Initially, when I started this, I did not know where to auscultate for a dog's heart. Eventually, you come to know. But then we have got drugs. Extensive propagation of evidence-based homeopathy in cardiac cases by social media, by YouTube, Instagram, radio, public lectures, webinars, press conferences, annual cardiology homeopathic workshops in September. Here we have homeopathy cardiology clinics in other countries like Malaysia, Australia, Morocco, South Africa, USA, UK, Switzerland, Dubai, and now Saudi Arabia. Residential summer and winter training programs, COVID helpers, extensive work done in homeopathy, in cardiology, in COVID, and homeopathic vaccination for metabolic disorders. Unfortunately, it's a new concept. I do not have the time to elaborate. I'll just give you one case as an evidence base so that I'll be able to finish. Medical angioplasty is a carbon remedy. So this gentleman came to us with soreness of the chest and eczema. Soreness of the chest, radiating to the upper back, arms and fingers with numbness and the left shoulder. And he had got eczema since right arm, childhood. The skin was dry and itchy, scanty discharge, and better after scratching. He was depressed because in homeopathy, we have to see the mental state of the person. So basically, when he had come to us, he was very depressed because his son was living separately. The concentration was difficult and he had frequent thoughts of his own death. Hypertensive since 5 years and he was on antihypertensives. He was already a diagnosed case of IHDs 2 years ago, and when angiography was done, it was a double vessel disease. 2 vessels was there, were blocked, but he could not afford angioplasty. Hence, he was only on symptomatic allopathic treatment before coming to us. His appetite, urine, sweat, and sleep were normal, but stool was hard and he was andropausal. Now, I don't know, I will not go in details what is andropausal and what is menopausal, but he was in andropausal phase. He was obese, 102 was pulse rate, BP was slightly high, 160/90. But when he had come to us, he was in pain. And that is why we had hospitalized him. And we took his symptoms: soreness, left chest, aggravated ascending, better by lying down, extremities, left upper limb, numbness, chest, constriction, tension, tightness. These are the 3 symptoms we took. We repertorized them, and arnica, cactus, and lachesis came. This was the ECG on admission. You can see the T wave inversion in lead 2 and lead 3 and even lead AVF. That means he was having inferior wall ischemia. So he was hospitalized. His blood sugar was 166. So arnica 0/1 2 hourly we started. A very, very simple drug like arnica. Day 2, mild relief. He passed stools, but chest discomfort continued. Arnica 0/3 4 hourly. So we directly jump potency from 0/1 to 0/3. We can do that. Day 4, status quo. So ultimately, arnica was not acting as to our desire. So we had to shift the drug. So we had a protocol, the initial protocol, which I just skipped because of this was the ISRA protocol. And we have got this lower left chest to back with numbness of the parts called latrodactys, LC. So that is the same drug which I have given because arnica was not acting. I could have shifted to cactus and lachesis, but I thought, why not follow the protocol? So latrodactys MAC. So unfortunately, we did not have latrodactys 0/1 because I am an LM prescriber basically. So we started latrodactys MAC 34 times a day. Day 5, the pain was 50% better. Although in homeopathy we regard arnica as a sorbate of homeopathy, still it did not give desired results even after ascending the potency from 0/1 to 0/3. But hardly latrodactys MAC 34 times a day. The pain was 50% better. We posted the patient for echocardiogram. Latrodactys 200 was given 1 dose, and we omitted statins and clopidogrel. Massage was given day 6, symptom free, and he was discharged on request. Fine. The patient went home. But what happened was, after 1 week, the pain was better, anxiety was better. We gave him another dose of latrodactys MAC. 3 weeks after, he was having chest pain, and so the children took him to another hospital. And there they did an angiogram again, and it gave triple vessel disease. So 2 years ago, he had got double vessel disease, and now this angiogram showed triple vessel disease. So he was under great stress whether to go for bypass or not. So he did not want to go for bypass. He came to me, "Doctor, please do something for me." I said, "Okay." I retook the entire case. Ailments from silent grief because he was suffering, his family had separated. Concentration difficult, fear of death, thoughts death of, indecisive, constipation, stools hard, sensation of constriction, skin eruption, eczema. We had totally actually not taken into account any skin complaints that time. But now, since I wanted to prescribe constitutional remedy, I had to take into account, and graphitis was a drug. Graphitis 201 dose. Now, mind you, graphitis does not have a single heart symptom, and yet we gave this drug, and you'll see the changes. After 1 month, eruption started increasing. So it was a good sign. Chest pain started decreasing, and only once he had got chest pain. 3 months after, there was no pain. Eczema was too high, excessive itching. Mentally, the patient was calm. The pulse was 86, BP came to 140/84. Graphitis 1M1 dose was given, only single dose. 6 months, we did a repeat angiography on 15/9/2018. You can see 5/12/2017, there's a blockages, all the three places, and 15/9/2018, the blockages have decreased tremendously. Ladies and gentlemen, I have another case, but the time does not permit. Hence, thank you so much for calling me here and listening to my thoughts, and I'll be happy to answer any of your questions. Thank you very much.
Thank you, sir. Thank you so much for your fantastic deliberations. I request the participants for any queries. Let us not miss this golden opportunity being Adil sir with us. So any queries, please raise your hands or put your queries in the chat box at the earliest, because sir has spared his valuable time out of busiest schedule. Please, audience, for any queries. Sir has covered maximum and maximum. It was very nice listening to you, sir. A golden opportunity for all.
Thank you so much, Dr. Nayeem. In fact, I was going to cover endocrinology, but then I heard one of the speakers is covering diabetes, so I did not touch purposely.
Yeah, yeah, sir. We are more delighted with cardiological prescriptions of you, sir. Really awesome.
Usually I don't ask questions and make comments, but today I am forced to do that. I am mesmerized by the presentation of the two panelists that homeopathy has a lot of scope, which maybe it is your fault, Dr. Adil, the fault of all the homeopaths, that you are not publicizing your work. You know.
Agreed. I totally agree on this aspect.
I am very senior physician, but to know all this for the first time at this stage of life is really so. Only
in Jeddah, people, my audience was all professors of medicine, cardiology, CVD surgeons, cancer specialists, all roughly aging 50 plus 70.
Now we want you to come to Riyadh, both of you, Dr. Piyush Gupta, and of course Dr. Rekha is our well-known family friend, so we can invite her. But you, both of you, we are inviting you officially. Please make it convenient to come over here. Of course, Dr. Nayeem.
Inshallah.
Yes, sir. I always been moderator. Yes,
no,
sir.
yes, this is what I'm telling. So please, and really, I'm not exaggerating. I'm really surprised that there is a lot of scope. And why should the patient miss this opportunity which is available? And I'm just so surprised for this. Why not? Why not? So please. Now let us, okay, it is too late, but let us start vigorously and aggressively to push all this Ayush, this mission we have taken up as a Saudi Healthcare Forum, and me personally and Dr. Satish, we are behind this mission very much.
I congratulate and wish you all the best, and if any help you need, I am there for you.
Yeah, please, we'll keep in touch. Thank you very much. I think the other people can ask questions. I have no questions because let me adjust myself to what I have listened. Okay, thank you.
Thank you. Yes, any questions? Please. Any queries?
Can I speak?
Yeah.
No, I am Dr. Joshi. I was practically thrilled to hear Dr. Adil's lecture. Such a highly informative. Now I was in fact suggesting Dr. Anwar only to make a team of such 3-4 doctors and finally make a big list of diseases that can be treated by allopathy, Ayurveda, homeopathy, straight away categorize them so that the patients can directly go to particular field instead of going here and there and getting unnecessarily complicated sort of. I think this is the right man now. The Adil is the best man to practically guide us because he has studied both allopathy and homeopathy. Such similar doctors make a big team there and finally make a big decision as to which diseases are to be treated by allopathy, which diseases are to be treated by homeopathy, and finally Ayurveda. This is my suggestion to Dr. Anwar Sahab.
Yeah. I'm willing to cooperate in any way. I am 24/7 willing to work for this purpose.
He is the right man, Sahib, to catch.
I'm willing to catch him and anybody he approaches. He gives me, I'm ready. At least Dr. Nayeem knows I'm very aggressive in this field.
Yeah, sir. Yeah, sir.
Very good.
Yeah.
Good.
It was
Good.
Hello.
Yeah.
Can I speak?
Yeah.
I am Dr. Sudhakar Reddy.
Yes.
I am basically an pediatrician. I am an allopathic doctor from Hyderabad. Actually, I did almost more than 35 years of allopathic practice and 14 years of homeopathy practice. I worked for 5 years in Qatar as a pediatrician. I just want to share a few things. First thing, as I want to initial comments, as you said, homeopathy is not an alternative system. After 14 years of my homeopathy practice, and sorry to say, add now, I have some publications also, particularly in COVID and dysmenorias. There is nothing like homeopathy cannot treat. Okay, I cannot agree that homeopathy is an alternative system of medicine. No, my opinion is homeopathy acts so deep. No other system of medicine goes so deep. Sorry, and my publication will be homeopathy. Somebody is talking, so I cannot concentrate.
Yeah.
My next publication will be homeopathy, the blend of spirituality and science. Okay. So I don't agree with the term homeopathy is an alternative system of medicine. Second thing is, of course, Doctor, I am very much impressed by Adil Chintanwala's like scope. There is nothing like limited scope in any particular disease. Wherever homeopathy, allopathy acts, except in emergencies, homeopathy acts. And if you want to study homeopathy in Saudi Arabia, when I was working in Qatar, there was homeopathy there. Somebody talking a distance, so in between. So first thing is, just say 4 words. Okay, the symptoms which are by homeopathy, no other systems of medicine understand. I know homeopathy, I know acupuncture, I know yoga. I am a Kundalini yoga master. Okay, the symptoms which are understood by homeopathy, no other system of medicine.
ईयरफोन दे रहा है
Hello,
ये कनेक्ट डाल नहीं है
what I personally feel is there is a lot of suffering beyond diagnosis, beyond clinical diagnosis. That is one thing. Second thing is, I published one article published in Hpathy Journal, the constitutional remedy in COVID. My opinion is, so far in 10.6 affected, 10 lakhs people died.
ईयरफोन्स दे रहा है
How people get like that. So,
Dr. Satish, can you mute the audience, please?
hello. In an advanced country like United States of America, more than 10.6 crores people affected as on today, and more than 10 lakhs people died. How is it possible that when the system is so advanced, why so many deaths? There is the highest number of deaths in the world. What I feel personally is, homeopathy work definitely based on the constitution of the system. This constitution is maybe a new term for an allopathic doctor, but not for a practicing homeopath. I feel if every doctor is has the knowledge of homeopathy like me, we would have at least prevented more than 50% of deaths in COVID. Okay, that is the second aspect. The third one is,
of course, everybody questions what is the evidence of homeopathy that it works. I just want to share one publication which is published in Saudi Journal, High Dilutions in Saudi Journal. If you are interested, I can forward that later, that publication also. There is a lot of scientific evidence to prove that homeopathic dilutions, they are the nano medicines. No other system of medicine goes so deep to act at the root level. I can talk of spirituality also in that. Okay. I think these are all the things. And lastly, I want to share one thing. Lastly, according to the International Foundation for Gastroenterology Disorders, 40% of gastrointestinal disorders are functional. They are labeled all functional, which is very, very unjustified. Because when we treat with the system of homeopathy based on the constitution, that 40% becomes almost zero in my experience. I think that article also will be published soon. So I think without my introduction to any one of you, thanks for allowing me to speak about homeopathy. And for people like in Saudi, sir, if you, Dr. Ziauddin is my classmate. I think you may be knowing. He was my classmate in medicine in Warangal. If you want to study really homeopathy, there are two options. One is you select so-called incurable diseases in allopathy and try with homeopathy. Or second thing is you select one area and try all the chronic diseases treatable by homeopathy. So this is a wonderful system of medicine. Only thing we should have the open mind. Thanks for giving me the time. Thank you very much.
Thank you, sir. There is a request from Dr. Adil, sir, that he will be leaving the virtual platform. It's really a great privilege, sir, to have you here. From the day I thought of organizing the second webinar, it was a dream to bring Dr. Adil, sir, to our platform, and the dream has come true. Thank you, sir, for being so instrumental in promoting this system of medicine. I suppose I have really picked gems for my webinar. Dr. Adil, sir, Dr. Piyush Gupta, and Dr. Rekha, ma'am. Thank you. Any further queries, please? If not, we shall go for the third speaker.
Somebody has raised hand, Dr. Muhammad Shafiuddin. Muhammad Shafiuddin, I can see the raised hand.
Okay. Dr. Satish, sir, please permit.
I'm seeing one raised hand, Dr. Muhammad Shafiuddin. He is an ophthalmologist from Bangalore, if I could recognize him correctly.
I think, yeah, I try to unmute him.
He himself cannot.
Okay.
Hello. Hello.
Yes.
Hello. Can I speak up?
Yes, please.
Yes.
Yes, I'm Dr. Shafi from Bangalore. What he said, Dr. Anwar Khurshid Saab, he knows me very well. He was just neighbor from Gulbarga. In short, just I was regarding Dr. R. He commented regarding the diabetic retinopathy. Hello. Hello.
Yeah, you're audible.
Hello. The question is to Dr. Adil, who said regarding about the diabetic retinopathy. So, stage what we differentiate non-proliferative diabetic retinopathy and proliferative diabetic retinopathy, and with which stage it can be helped out with the homeopathic drugs. Hello.
Sorry, sir. Dr. Adil, sir, has left.
Already left.
Busy.
Okay.
Yeah. He was busy.
Okay.
Yeah.
No, we can.
Okay. As an
anyhow,
we can note down. We can note down your
Sure.
We'll be back to you.
Yeah, we'll note down the query.
Okay. Regarding diabetic retinopathy, what he said, the treatment we can withhold the progression of diabetic retinopathy. So what type of drugs can be used for it? Because then we can hold it. Because we daily we see nearly 4 or 5 cases of diabetic retinopathy, the non-proliferative diabetic retinopathy that could be cured as early as possible if it can be treated by homeopathic. That's what he said. So, so where to find out in Bangalore? Is there any best practitioners also we can just refer for it in Bangalore?
Okay. Okay.
Okay, we give other drugs and all that. Further, we go for laser therapy and injections and all that. DME for all these things are there. Okay.
Okay. Oh, yeah.
Thank you so much for giving me this one. Okay.
Could you
Thank
please
so
mail
much.
your address in chat box, sir, so that we'll mail you all your queries.
Okay.
Can you please give your mail? Yeah.
Okay.
Dr. Anwar, Dr. Anwar Khushi knows very, very well.
Yeah.
He knows me very well.
Yeah. I will.
Thank you. Thank you so much. Thank you so much.
We can mail your queries. Thank you.
Thank you. Thank you so much.
The highest ideal of cure is rapid, gentle, and ending restoration of health by most trustworthy and least harmful way. Our third speaker for today is a dynamic and versatile research scholar, Dr. Rekha Karnam Srinivasan. My pleasure to introduce and invite you, ma'am, to the virtual platform. Dr. Rekha Karnam Srinivasan, ma'am, she has completed BHMS from Government Homeopathic Medical College, Bangalore. Postgraduate fellowship in homeopathic psychiatry from Pioneer University, United Kingdom. Completed diploma in mental health and counseling from NIMHAS. Got trained in advanced classical homeopathy under the tutelage of legendary professor Dr. George Vitholkas. Ma'am is an independent practitioner at Raj Homeo Clinic, Chennai. Ma'am is former Director General in Indian Homeopathic Research Center, an affiliate of Indian Homeopathic Medical Association and International Association of Qualified Homeopaths of Indian origin. Ma'am conducts more than 10 webinars with renowned speakers as a part of yet to be published Essentials in Case Approach and Management of Autism Spectrum Disorder with Homeopathy. Ma'am has been the editorial board of the Homeopathic Medical Panorama for the past 4 years, the house magazine of the association, and has compiled medical book on treatment of autism by homeopathy. Ma'am has a key role in developing questionnaires against during COVID-19. Dr. Rekha ma'am has more than 12 articles published in famous national and international journals. Ma'am has started blogging since 2014 to educate one's patients about homeopathy and possibilities of treatment through homeopathic care. The following are to name a few presentations, more than 10 webinars in clinical subjects such as thyroid disorders, adapting cognitive behavior therapy in homeopathic practice. Ma'am has presented original analytical paper evaluating levels of health, an essential step in cancer care, a perspective and international integrative oncology conference at Kochi. Ma'am has presented an analysis-based original paper on complementation phenomena, a rare genetic phenomena at Nutritional Scientific Conference at Sri Krishna Homeo Medical College, Kulakeswaram. Ma'am was a part of Indian Homeopathic Medical Association organizing committee by heading scientific committee to choose research papers of the faculties for its second International Homeopathic Conference held at Germany. We are very fortunate to have you, ma'am, as our speaker. Without any delay, I welcome Dr. Rekha, ma'am, with a thunder of applause. The floor is yours, ma'am. Thank you.
Thank you so much, ma'am, for the wonderful introduction. Am I audible?
Yes, ma'am.
Yeah.
Yes, ma'am. Very clear.
Clear. Oh, okay.
Clear.
So there was one small problem with my laptop. That's why I'm asking.
Yeah, it's clear, ma'am. You can begin, ma'am.
Yeah, I'm trying to share.
Yeah.
Uh,
Dr. Satish, please mute all the participants. खाना नहीं खाए
I'm extremely sorry for the delay. I had some issues with my laptop. So I think hopefully I'm audible. Yeah, let us start with homeopathic management of diabetes. So I will be more concentrating on diabetes management with homeopathy rather than talking about the regular things in homeopathy or diabetes. So here, as you all know, diabetes is a metabolic disorder with excessive glucose in blood circulation. In diabetes, homeopathy, in diabetes, our body is not using insulin properly, and there is excessive glucose which stays in the blood, and it has inadequate insulin secretion or insulin action or both. So here insulin resistance is also there. Pardon me. So there is high blood sugar in the body, which can have serious life-threatening conditions. Both type 1 and type 2 diabetes result from combination of genetic or hereditary predispositions and environmental factors. Am I audible? Is it clear?
Yeah.
Yeah. Due to some technical issues, I am having some hitch. Pardon me. I will streamline it as we go by. Yeah. So basically, Dr. Adil has covered most of the things, and I have here left to talk about the clinical ways of handling diabetes, because most of the people will be visiting clinicians rather than where we have setups like what Dr. Adil has, or researchers, or also there is a totally different scenario. So if you are visiting a clinician, what and all you can be expecting from a doctor. So that will be basically I will be covering in this, and hope it will be helpful for you. And in homeopathy, we treat various stages with various ways. And here we have clinical staging of diabetes, which can be very helpful to know whether it will be help with the homeopathy, or you have to take more other options as well. So here stage first where there is pre-diabetes. So this is more potential area where individualistic approach will be very, very helpful. There is only impaired fasting glucose tolerance. And next level will be impaired glucose tolerance. That is GTT, they will tell, no? They will do tests and all. So the glucose tolerance will be changed. And there will be established diabetes. That is, there will be put on medication. And then there is early stage of complications and advanced stage of complications. So let us explore what and all are the potential ways homeopathy can help in these stages. So in pre-diabetes, where there is pancreas is not producing enough insulin, and or body cells are not responding enough. So this by this blood sugar will be very high, but not labeled as diabetes. So without intervention, they can be healthy, just like for 10 years or more, or few may not get into the diabetes at all. It depends totally individualistically. But there are few cases where there is no diabetes label, not in that level, but they will suffer from cardiac arrest or other complications. So it is very, very important that pre-diabetes should be treated, because this is a combination. You can see there could be hypertension, insulin resistance, abdominal obesity, and dyslipidemia. There is low HDL. So this is called as metabolic syndrome, which is a starting point for most of the problems. Now I am not getting into other endocrinology related issues like PCOS or hypertension or thyroid disorders and other things, because I want to talk about diabetes. But all these things are interrelated, and you can see that metabolic syndrome, what we basically call, is the first step towards having any of the endocrinological problems. So here, this is pre-diabetes. And see, for example, if I could give few case examples, let me talk about my own parents. Both have very strong family history, and they could be not put on hypoglycemic drugs like conventional drugs up until they're 65 or 70 years of age. So that is one way of delaying the diabetes level. So they are having good health status with homeopathy, and they were started their drugs at that age. So this is one way of handling with homeopathy. It's possible delaying the diabetes. And how can we know that this is pre-diabetes or diabetes? This your diabetologist will tell you. This is a even we can treat normal people on constitutional therapy, and who have very strong family histories, or we can treat pre-diabetics, and we can even treat diabetes. So you should worry if you are pre-diabetic, and I think you should start taking care, seeing a homeopath. And what is the treatment way? We treat just to delay the progression from pre-diabetes to complications in diabetes. There will be, of course, lifestyle changes, weight loss, and medication will be there, whichever is essential. But standalone homeopathic treatment also can do in this stage. And as you can understand, there is no signs or symptoms in homeopathic individualized constitutional therapy is the most suitable for this stage. One thing should be darkened skin and behind the neck, and this is one of the ways you can know it could be pre-diabetes. And this can also be lessened, like that color changes will also be lessened, and you will know that homeopathy is definitely helping you. And now we are talking about type 2 diabetes or NIDDM, which is the most highest number of patients come under this section. They have insulin resistance, or the insulin is not produced enough in the later stages. So there is lack of insulin. So these patients have high levels of blood sugar, which will be helped with medicines to reduce the blood sugar level. And here the most common problem is because of lack of exercise, that is lifestyle problems, as well as stress. Stress is we should know what type of stress is more contributing for this. The stress that is having deadlines, you have no way out sort of stress. It is not the good one, like what doctors or army people or those who are running around to help others. That type of stress usually won't lead to much problems if their lifestyle is conducive. But they have usually people who have very heavy work and they have to meet deadlines, they will have bad type of stress. So they are more vulnerable, who will lead to lack of sleep, and then that will lead to other hormonal imbalances. And in this category, one of Mr. S, he had diabetes for past 15 years. He was taking medication, but it was around 350 to 400 DL per mg, and he had other complications too. So with added on homeopathic medicines, his sugar levels came down below 200, 250 range it is now, and his complications have also reduced. So this is the way we help, and it will be helping to further reduce the complications, and may even help to prevent complications. So this is the way we help. And what are the symptoms of diabetes? So these are very essential things, and most of you will be aware of already. Hypoglycemic symptoms will be sweating, pallor, irritability, hunger, lack of coordination, some dizziness, something like that. and sleepiness, excessive sleep. So this is a very problematic because it may lead to permanent brain damage if there is one episode of hypoglycemia, severe hypoglycemia. Should be very careful about this. And doctors usually advise all the diabetics should keep something, chocolate or something with them, and whenever they feel some problem they should have it. Yeah, we definitely say you should do that. Along with that, we have medicines which can make sugar levels normal. See, usually patients ask me, I'm a diabetic, I'm taking already allopathic medicines and it is under control. And if you take homeopathy again along with that, will that lead to hypoglycemia? No, that is not the case. Because we are not targeting sugar levels alone. We are treating the patient as a whole, and along with the diabetes control, the patient's overall general health will be improved, and he is helping himself, and not medicines are targeting his sugar levels. So in hyperglycemic symptoms are dry mouth, excessive thirst, weakness, headaches, blurred vision, and frequent urination. See, all these symptoms will be very beautifully handled with homeopathy. There is no doubt about that. But in case if that leads to some emergencies, so we will be always working in tandem with diabetologists, because we don't want anything to happen to our patients. So it is both the ways. We work alone, like or we work in tandem with diabetologists. Both is helpful. And type 1 diabetes. There is failure of pancreas to produce enough insulin. So this was juvenile onset diabetes, that is in young children. So there is loss of beta cells and autoimmune response. And there is a gradual progress in severity. And now researchers are saying that there is something which has triggered this autoimmune response. And by taking care in the early stages and lifestyle changes and other environment factors, we can help them. So this is a very good news for us, because homeopathy is basically to help in preventing the further damage. So essentially it will also help in these cases if started early. And as already Dr. Adil has mostly told what is the role of homeopathy, to what extent we can depend on homeopathy in cases in acute or very difficult to treat cases. So this is, our potential is helping to prevent further damage. So there was also a study was conducted. See, I am telling, see, I treated so many cases, it helped and all. That won't serve the purpose. So I'm quoting a study where patients were done a survey in families where children were taking CAM therapies along with the homeopathy was 14% in that, and their improved well-being and quality of life was noted in them. And they were not stopping or changing any of their already medication which they are already in. So this is essentially the way we help. And what about gestational diabetes? This is the third main form, and most of the ladies who have family history. So parents, grandparents have family history, doctors ask, and they will tell maybe you have to be screened for diabetes, and they will be, mostly they will not be put on medication as far as possible. But after delivery, they may continue to be type 2 diabetes in 10% of cases. This is a very potential area, because again, homeopathy is a very safe medicine. It can even be given during gestation, and also it can be helped after delivery to prevent it going on to be a type 2 diabetes. So for my personal experience, I have treated a few cases. In one case, the lady was around 26 years old. She developed type 2 diabetes after delivery, and I could treat her for almost 1 year. I could help her not to get into any complications, But as a whole, her sugar levels didn't come as we expected. Like it was around 7.5, 8.5, in that range. HbA1c was there. So essentially she took other medications as well. So what I'm saying is we can help, but it is case to case basis. But definitely we can help, and it could be very good as well. And what about LADA, or latent autoimmune diabetes in adults? See, when COVID has stuck now, and we know it is an autoimmune disorder, and we are seeing more autoimmune problems nowadays, especially thyroiditis, or even we have seen new onset diabetes after COVID. So this is a very important area where autoimmune thing leads to diabetes. So here, patients develop at around 30 years of age or more. Okay, but they are they are rapidly progressing into insulin dependency. So they were treated as type 2 diabetes, but they are not. So here they say personalized medicine approach will be very helpful for them to preserve beta cell function, because beta cell is rapidly distracted due to autoimmune activity. So this is a very potential area for homeopathy, because as you all know, homeopathy is very good for autoimmune conditions, and we can help them in preventing to getting into diabetes or diabetic complications. And I have treated few cases in this group where few were out of medication. They could handle with the lifestyle and dietary changes, but I can't say that they will be remaining as no diabetes, something like that. They may be labeled as type 2 diabetes when they will be old enough, like 65, 70 years, and that is good enough, I think. So I always tell them, keep a watch. Don't think that your label has been removed. You have to continue to take homeopathy or all essential precautions, so that you are not having any complications, any problems. So this is possibility. And next, we are, how we'll be helping with homeopathy. There are certain mother tinctures like CGGM, Jambolinum, or Gymnema sylvesteria. These are all over-the-counter medications. They have definite effect on lowering the sugar levels. But usually I'm a single dose prescriber. We generally we don't go for OTCs as well as combinations. But if you ask me whether it is better to have a herbal labeled medicine or homeopathic medicines, I will say homeopathic labeled medicines are far better. They are safer. Either they will help you or they may not do anything. That I can say. But provided if you can see a homeopath, that will be the most ideal thing. And homeopathy helps in numbness cases. Very, very beautiful results. The patient will tell their sole, no, their leg, below the leg, that will be like a sponge. They can't step on that. And some people will have pricking, burning pains, stitches, and all things. And those things are very well handled with homeopathy. We have helped so many patients. It could be standalone homeopathic medicine. It could be along with other medications, physiotherapy, and all other things what doctors say. All other precautions taken care are. It could be at whatever level we want to have, like single symptom we want to get relieved of. Yeah, that can be done. And we were talking about complications. So I told you again when we were talking about hyperglycemia, diabetic ketoacidosis is a very potential dangerous thing, and it can lead to hyperglycemic state and death. They will be going into coma and they will die. It's a very but it takes some few days to develop to that level, to get into that hyperglycemic state. So if we could make it out in very early stages, maybe homeopathy can help, but it should be case to case basis. But in long-term complications, along with all the screening, all the steps taken, we can add on homeopathy, especially in cardiovascular diseases. So, as already Dr. Adil has given us such a beautiful array of conditions what homeopathy can be helping in and what can be limitations. So I won't be elaborating in these things, but I will only talking about from a clinician's point of view. And again, most of the things have been spoken about. So in diabetic cataracts, there is very less scope for homeopathy. We can, they say they can prevent cataracts. I'm very wary about that because no, I don't think so. We can help to improve the problems related to eyes or the symptoms or even clarity and all we can help. But cataracts, most probably we have very less thing. Diabetic retinopathy, already Dr. Adil has given us a wonderful insight in that. I have personally treated a few cases and we have good results, but like they will do that microsurgery, like they will have that quartering the retina so that those micro bleedings will be in the retina will be there, no, to reduce that. So in certain cases, we will bring upon the burning and itching of the eyes and other complications related to the eye, and retinal detachment also of works very well. So it is also case-to-case basis, but definitely it can be added on because very less scope in diabetic retinopathy in general, I can say. So definitely homeopathy can be tried. And in glaucoma also, no, almost I don't even think we can help in that case. So, and when it comes to microalbuminuria, yeah, very, very good results. And myself have treated so many, helped so many patients in this. See, it is the starting stage of nephropathy, and if we could help in this level, it will be very good for the patient. Their progress into kidney problems will be very less comparatively. So there will be very slow progress. They will take years to progress to that level where they need dialysis or something like that. So it is as a good add-on. And gangrene of the feet, very good scope, very good scope. I have treated, and it takes time. Yeah, surely it takes time, but definitely I can say homeopathy is one of the best options for diabetic foot or gangrene of the feet. So definitely you can help patients. And diabetic neuropathy, very good scope in that. And basically in all neurological conditions, homeopathy has a very good role. And as already I told, those pricking, burning sensations, everything helped. And autonomic neuropathy, that is sweating, suddenly falling, unconscious palpitations, helped very well with homeopathy. And even erectile dysfunctions I have helped with the homeopathic medicines. It helps, like especially around the 45 years of age, newly developed patients who have diabetes, they will have this problem and they find it very difficult to convey to the doctor. So don't do that. Please start telling that to your doctor, your homeopath, and you will get help. And that will prevent further problems. If it's a long standing, like 2 years, 3 years, it will be difficult to handle, difficult to help. So you start, whenever you start noticing it, you just take help from a homeopath. And skin conditions, especially chronic itching, whole body will be itching and there will be no eruptions. It's a very troublesome problem for patients. They'll be applying loads of what to say, moisturizers and other creams with no help or very less help. Yeah, you can do all the things along with homeopathy. It helps very wonders. And other things also, white discharge in females with itching and so many other things. Anything chronic which is not helping as it should have been. you can think of diabetes, right? Your doctor will tell, I have been coughing for so long time. It is not getting relieved. So they will tell, oh, okay, go and test your sugar levels. So in that way. So whatever is long standing, not responding as it should be, you think of diabetes or changes in your sugar level, and you think of homeopathy as well, because it will be helping in those cases. Yeah, surely you think of homeopathy. And coronary artery disease and peripheral vascular disease. Peripheral vascular disease, we are talking about this venous thing, that is varicose veins. It's a very common thing. Patients will have without diabetes or with diabetes, both will be there. You will have venous ulcers as well because of that. So this will be helped with homeopathy. Sure. I don't say that varicose veins will be vanishing. Most probably it is not happening, but symptoms will be totally relieved. That I can guarantee. I have helped many patients with varicose veins who say, no doctor, it is still there. It is, you can see the veins, but pain is not there or itching is not there. So that can be achieved. And with 25% of Indians will be suffering with diabetic foot ulcer, and which is a very good scope with homeopathy. And this is some of the ways where I have collected few evidences so that people can be knowing it with evidence. It is not just a anecdotal, it is evidence based. So there was a individualized homeopathic treatment in addition to conventional treatment in type 2 diabetes, and in Hong Kong it helped them with the standard conventional treatment and better than that. So that was a very good result. And 5 cases of stasis dermatitis with venous ulcers. So I told you venous ulcers, it helps you very much, very well. And there is a good help in symmetric polyneuropathy, that is nervous system disorders, homeopathy helps. And chronic periodontitis, that is gum diseases, homeopathy helps very well. And there was a study conducted in that. So in diabetes, there is also one issue of having dental problems or gingival problems. Gingival problems is gum issues, which is usually not helped with the vitamin medicines or other things. It's a very difficult to treat things, and homeopathy helps very well in those cases. Also chronic cough, I mentioned. I have treated one case where she had cough for almost 2 years. She got relieved from her cough, as well as her progress into other diabetic complications was reduced, halted. But even she was diagnosed with cardiac disease after 3 years, but that was also very minimal, and she was helped with the conventional medicine as well as homeopathy. So in gangrene also, they have presented 5 cured cases of different varying cases, and homeopathy helped by stimulating the body's ability to heal. So gangrene is a very notorious thing. You understand the pain, not just pain in the foot, but you are losing it. So that is very difficult. So digest, like you can't take it, like losing one's limb. So homeopathy can help in these cases. So definitely before giving up, take help with homeopathy, and then we'll see the results according to individualistic responses. So it helps in wound healing and establishes circulation. That was the good thing. And to just summarize, and especially I wanted to talk about carbuncles. Carbuncles are skin boils. It's a very painful condition, and most of the time doctors cut open it, but it is not helping much because diabetics heal very slow. You know already. It's a very painful condition, and homeopathy can help so well in those cases. So anything related, you have something chronically and it is not getting well with normal treatment, you visit a homeopath. If you want to prevent something also, you can see a homeopath. Or you want to get rid of single symptom, I want only this one, I don't want this, yeah, that also is okay. You can see a homeopath. But homeopathy will provide overall care so that other things will also improve. That is the side effect. And here just to summarize, pre-diabetes, very good scope. Impaired glucose tolerance, very good scope, and maybe standalone. Established diabetes, good scope, maybe as add-on or standalone, it depends on the case, but I usually think it is add-on. Early stage of complication as an add-on. Advanced stages of complication also very good scope as an add-on. So there are research trials which show that diabetes can be prevented in people who are at high risk using lifestyle modification, drugs, or combination of the two, and also homeopathy will add on it. Yeah, why not we add on homeopathy to this list? So I'm so thankful, I'm grateful to one and all for this wonderful opportunity. In fact, there was a very big problem in my system, and I was very nervous. I couldn't talk as I should have started. Pardon me for that. But it's a great privilege to be with you people like Dr. Anwar sir, Dr. Satish, Dr. Nayeem, Unisa. I just can't tell how privileged I am to be in series with the speakers like Dr. Adil or Dr. Piyush. And it has been wonderful every time I have been with the Saudi Forum webinars, whether it's Ayurvedic or other interventions as well. Thank you so much for this wonderful opportunity. And I am looking forward for the invite as well, whether I could visit Saudi. It's a dream come true maybe. Thank you so much.
Thank you, ma'am. Thank you, Dr. Rekha, ma'am, for being so instrumental and so appropriate in your studies, ma'am. Really, the recent study that ma'am has done and presented the paper at NAPCAM was really very awesome. Thank you, ma'am. Thank you so much. Yeah. Any queries regarding the management of diabetes with homeopathy? Any queries, please let me know either in the chat box or you can come live raising the hands. Please, participants, be active. Let's not miss golden opportunity of sharing each other views, knowledge.
Can I ask some questions?
Yeah, sure.
Yeah, as I said already, I am Dr. Sudhakar Reddy, pediatrician practicing homeopathy.
Yes.
I have a few questions for you. One thing is, can you manage any diabetic patient comes to you? Can you manage without support of allopathy diabetes? Okay, and you said lifestyle, diet, everything like everybody knows. Suppose somebody comes to you in pre-diabetes stage. Do you have any medications? Oh, and it is already understood that he is maintaining diet, he is doing exercise. Do you have any medicines to work in pre-diabetic state or in diabetes? If you use the medicines, homeopathic medicines to control diabetes without the aid of allopathy, do you base your treatment on constitution or do you use some selective medicines? You said mother tinctures. What mother tinctures do you use? I know commonly used mother tinctures are Syzygium, Gymnasia, Cephalandra, Cretaceous, phosphoric, so forth. Can you manage without allopathy support? Repeating the question. And if you are using the medicine, do you take the help of constitution or any other medicines in your experience? Thank you.
Yeah, sir. Your question I will talking in parts. Okay. Can we give homeopathy standalone? As I have already told, homeopathy is holistic. So we are only treating the person. That is constitutional. But in cases of established diabetes, we can't do that alone. We are treating constitutionally to improve their health condition, but we will use remedies to reduce their blood sugar levels as well. And in pre-diabetes stage, usually we may not be needing any such remedies to target sugar levels or something like that. Usually we can handle with constitutional therapy alone, maybe. But it is almost case-to-case basis, as I have already told. And even in established diabetic cases, like I told about my own parents, my mother was diabetes at the age of 50, and she started her conventional medicines by the age of 65. So that 15 years we handled with homeopathy. So, and she didn't end up in complications by God's grace, as well as homeopathy, I can say. So this is the way we can handle it. It is totally case-to-case business, but we need lots of inputs and lots of care. And of course, lifestyle changes and other things, definitely it is a must. That is one thing. And when it comes to, mother tinctures I am talking about. Yeah, mother tinctures helps in reducing the sugar levels, but it works wonders when it is clubbed with the constitutional therapy. That is the way we help. Only mother tinctures, if you are using, that is well and good, but it will not be consistent results. As I told, over-the-counter medications, which help for 3 months or 6 months, and then you are not getting the results. So in that way, but when it is clubbed with constitutional remedies, you will have a consistency, as well as we may have to change remedies. That is there, but we'll have better results. That is one thing. And some other question you had asked about mother tinctures, and any other questions you had asked along with
madam.
this?
Actually, my experience is I tried to treat at least I treated 20 patients with constitutional medicine and taking the help of mother tinctures. My experience, without modern medicine, allopathy medicines, we cannot depend totally on homeopathy. Though I am passionate about
I agree.
this, but in diabetes,
I agree. Yeah.
Unless you do lifestyle and diet modifications, I think we cannot even postpone pre-diabetes or diabetes. So my experience is allopathy is first, then homeopathy only to support. At the most, we can reduce the dose of the medicines or better sugar control. That is what is my experience. But for any diabetes patient, cannot solely depend homeopathy. Even though I'm passionate.
That is again case-to-case basis, sir. That's what I told. In pre-diabetic stages, standalone homeopathy can be trusted. But in established cases, it depends on the levels. See, all diabetics will not be having 500 sugar levels or 10 or 13 HbA1c. They will be like in borderline 250, 300. Those are all tolerating well. Even a few patients we see who's immediately starting allopathic conventional medicine, they will end up in hypoglycemia and they will be complaining, I have dizziness, because they are not, even though their high levels of sugar in lab test. So it is case-to-case basis. And in established diabetes, that is in 3rd, 4th, and 5th stage, whatever I had previously posted, there I totally agree what you are saying, but still homeopathy has some scope. That I can say. Because whenever we give constitutional therapy, you are helping them to improve overall health. So that definitely helps in progress of the disease.
The most important, immune system is boosted with our homeopathic medicines. And nowadays, beyond doubt, boosting immune system is a great modality of treatment, which only homeopathic medicines can be doing these days.
Yeah.
So it's not a debate whether allopathy can do or homeopathy can do. It's all an integrated approach. We need to integrate ourselves and come to the success of medicine.
And I think this is a very valid point, because patients will be thinking black and white. They will think, okay, I am taking homeopathy, now I'll stop everything. So many people we advise them, no, you don't have to stop the conventional medicine. It is not advised. But if you are like, there is one batch who are obsessed about herbal medicines, and they think if they are taking homeopathy, they are safe, they can stop everything. No, we advise them, no, it should not be done. You should never stop conventional medicine without your doctor's advice. That is your
Let's talk about herbal medicine. But other thing is, like, if usual common complications, problems of diabetic patients are tingling, burning, or maybe gangrene. There, I think we take the general repertory. Nothing like say only diabetic patients need separate medicines. I don't agree with that. We just take the help of general repertory and treat either based on the complication or rubrics.
Yes.
That is what I have to say.
Yes.
Thank you. Thank you, madam.
Thank you. Any other queries? Yes, the participants, if you have any other queries.
Now, I saw one query in the chat box. Homeopathic medicine for treating gingivitis and periodontitis. Yeah. Even though we say it is individualistic usually, but especially in gingivitis and anything related to teeth, as already Dr. Piyush Gupta has suggested too, along with that, I will suggest usually you can start with Plantago mother teacher. It has wonderful results. I can say it safely in this platform because we homeopaths usually won't reveal the name of the medicines, but Plantago mother teacher, I can say it works wonders, and it prevents gum damages as well as gums damage and the teeth, tooth pain, and it relieves most of the symptoms related to tooth and gums. But of course, you may have to see a homeopath or even your dentist as needed. So I'm not really substituting, but I'm asking you to, you can start with Plantum mother teacher. It can be used as a mouthwash. You can keep it in your mouth. You can take inside 10 drops with half glass of water, or you can put it into cotton and you can place in the tooth which is paining. It works wonders. Plantago mother teacher.
50% of the homeopathic medicines and 50% of the dental interference will surely bring good results in dentistry.
You have been muted.
Dr. Nayeem, you are muted.
Muted.
Dr. Anwar Saab raised his hand.
Yeah, no, just one simple comment that I really enjoyed thoroughly the presentation of Dr. Rekha, ma'am. Anyhow, thank you very much for coming for the second time on honoring the Saudi Indian Healthcare Forum. Thank you very much.
It's my privilege. I'm honored. Yeah. I saw it. Do you have any homeopathic medicine for trigger finger? Yeah, we have good remedies for that. You better you see a homeopath that will help. Yeah, very good results in trigger finger. But basically, we need to know what is the reason for that. Trigger finger is not a single symptom. You need to know the real reason, and it can be helped. Yeah, even clinicians like me have helped many patients. You better see a homeopath.
So I'd like to invite Dr. Satish Reddy, sir, for a warm acknowledgement. Before inviting, let me give a very short introduction of Dr. Satish Madhirevula Reddy. Sir is PhD in Molecular Cellular Biology and Developmental Genetics, South Korea. Molecular Geneticists, Center for Genome Medicine, King Faisal Specialist Hospital and Research Center. Sir is Executive Board Member for Saudi India Healthcare Forum and Editorial Frontier in Genetics and Pediatrics. With a thunder of applause, I welcome Dr. Satish Sir to propose the vote of thanks.
Hi, good evening. Thank you very much for the grand introduction by Dr. Nayeem. So it's a great honor to have all the speakers, Dr. Rekha and Dr. Piyush and Dr. Adil. So here, like I think Dr. Sudhakar is giving the balance between the homeopathy and other medicines, actually other medication systems. Yeah, he's I mean, in one way I will agree with him. So whereas the modern medicine is going with genomics in a personalized medicine context, but whereas the research and the evidence for this homeopathy is really lagging. That's the reason we are discussing all these points actually. So now while I was listening to Dr. Adil's speech, I have seen many diseases are monogenic causes actually. So what they really having cure, that's another debate. But for the better management, maybe this could be an alternative approach for the better management. So considering by listening all the speakers, I hope we'll start at least we can start using the alternative therapy where it's really required. So thank you very much. Have a good night. Bye-bye.
So take home message.
Take home message, let's where it's required, let's use this therapy. This is the best way for long-term diseases. So along with this is what that's what Dr. Sudhakar is keep insisting actually. So
So I would like to say, gone are the days where homeopathy is considered as alternative system of medicine. These are the days where homeopathy is considered as an advancement in modern medicine. Thank you so much. Yeah, thank you. I really acknowledge Dr. Anwar Khurshid sir, our speakers, Dr. Adil Chimtanwala sir, Dr. Piyush Gupta, Dr. Rekha ma'am, Dr. Satish sir, and all the participants who deliberately made this webinar a successful event. Thank you so much.
I want to thank Dr. Sudhakar Reddy. Where is he? Let him come.
Yeah, Dr. Sudhakar Reddy.
He's not coming on
because
video.
We learned
yeah, and why is he hiding himself?
No, sir. From your side, you have to open. Oh, my video is your side.
Why?
Okay. Dr. Satish sir, yeah.
No, you can open your video.
No, you cannot start your video because the host
has no. I don't think so.
Yeah, I think it is not there now.
Where are you? Come.
I am in Hyderabad. I'm in Hyderabad.
Okay.
For last 1 year, I was in USA and Canada. I do only online practice, that too homeopathy only.
Homeopathy.
So I see only 2 patients a day.
How many?
I spend 1 or 2 patients a day. Because I spend 2 to 3 hours with a patient.
Oh, really?
When I was a pediatrician, at least 70 children a day. So that is the thing. Other thing I just want to tell you openly is, as Madam said, it's not advanced in modern medicine. Homeopathy is a separate system of medicine. I think people should have some spiritual background to really understand homeopathy. So, because I don't know what examples I have to tell you. There are so many symptoms from which I suffered. If I tell you the list of symptoms I suffered, usually modern medicine doctors, it is not trained in to understand the symptoms. Like patients have many symptoms, which modern medicine doctors are trained to understand them. This I am like stressing this point. This is the only homeopathy can do that. Suppose Ayurveda is there, it is based on Vata, Kapha, Pitta. But suppose somebody says he has a pressing pain in right scapula and needle poking pain in left scapula. What do you understand, sir? What a modern medicine doctor will understand. But homeopathy, it exactly points to the medicine. I'll tell you one more symptom. anxiety in the midnight to close the eyes. In the middle of the night, patient opens eyes, he is afraid to go to sleep again. Like I can go on a big list of symptoms. So, I'm really happy to be associated with you for the first time.
Okay, but
These
no, we are also very happy to have you. Can I get your mobile number, please?
Actually, Ziauddin is my classmate in
Oh, I
medicine.
I know. He did not come in spite of my repeated. He's
prob-
my neighbor. We are working in the same hospital, but I want to take from you directly.
My number is +91, sir. India 961 96
96
181
181.
33
Huh? What?
96 181 33
33
191.
191. Okay, good.
And I'm so fascinated about homeopathy. My email ID.
No problem. Once phone is there, we can take other things later on. What we do is we will have one session with you. Okay.
I'll be
Because
interested
and this combination is very important for us, very precious. Somebody allopathic medicine plus homeopathic medicine, like your phone is closed or maybe wrong number. You are
No,
given
sir.
the wrong number. Oh, okay, never mind. I will take from there. I will take from you. You are given wrong number. No, I'm joking. No, I'm joking.
96.
No, joking. Don't worry.
And please just listen to my mail ID. My mail ID is tryincurable@gmail.com.
Oh my God. Very, very nice.
That's my fashion.
What is that?
Try incurable.
Why?
Try, TRY, try.
Try.
Yeah, try incurable.
Incurable.
@gmail.com. I think that is my fashion.
Very good. Very good.
Yeah.
Okay, Reddy Garu, thank you. Jazak.
Thank you. Thank you meeting you. Thank you, madam. So
thank you, sir. Being privileged to be associated with you. Thank you so much.
Definitely will be. Sometime I want to see experiences also. So okay. Thank you very much.
Thank you. Bye-bye. See you all.
Bye.
Bye. Good night. Happy Diwali for all. Thank you.
Thank you, Dr. Satish. Because you deserve a big
applause.
Thank you so much. In spite of his very big.
You're all welcome. Welcome.
Yes, schedule.
It's kind of education session for me. Thank you very much.
Thank No, I wanted to ask one question to Dr. Adil, but on your behalf, what about genetic diseases? But I thought you will ask, so I kept quiet.
Yeah, this is what I was like. He mentioned a lot of diseases. They are monogenic causes, actually. I don't know how. Like roughly like 7 diseases I have noticed. They're monogenic and polygenic. Maybe here he may address the partial clinical manifestation. May not be all.
So we will wait for Dr. Nayeem to conduct another webinar.
Yeah, because for instance, epilepsy is a too heterogeneous one.
Yeah. Then no, at that time we'll prepare a question full of questions. That this time we were very lenient. So
this time we are sensitized, and the next time we shall have a full batting.
Yes. Okay. Thank you very much.
Yeah, I can say one thing about genetic diseases. Yeah.
Yeah, please go ahead.
Please, ma'am.
Yeah, about genetic diseases, as Dr. Satish was mentioning, so it is like 50-50. Like homeopathy has very potential effect on research has been done. Most of that has been well proven, but again, depends on case-to-case basis. I can say even in autism, we can help very well, but again, it depends. So.
No, but autism is.
We can't streamline all the results. Like
no, autism itself is not.
You can't say in each case like.
Autism is not a monogenic
disorder. But no, what I'm saying is we can't be generalizing. That is the main drawback. You can say drawback or you can say whatever, but the thing is it can't be generalized.
No, it's not
The
like that.
genetic
For instance, in the
diseases,
modern
homeopathy has a very great potential.
No, for instance, for example, you have a CP gene
Great
mutation in an individual. He will be like, he may not respond to warfarin. Okay, so since you know the genotype of the individual, we may not refer the warfarin. But in the same way, so we don't have a clear study on all these kind of alternative therapies. So once we have like thorough catalog for all these things, then we can have a fruitful discussion.
We don't have.
Now it's premature.
We don't have it.
Yeah.
We don't have it.
Yeah.
Genetic
But
disorders.
great potential is there. It is.
Yeah, Javed, raise
Thank
your
you.
hand. Javed, you can talk.
Yes, I have a question. Do you have a treatment for alopecia in homeopathy? And what is the approach for that?
What is that? PC?
That is
Alopecia.
Disorder most probably, and it has to be dealt with disorder, and it has to be treated as a constitutional one. So external medication or specific remedies won't help. No help at all with the specific remedies. You have to see a homeopath. Treatment has to be done. But very good results, most probably a very good results. Usually homeopaths will present more of alopecia cases because basically they get very good results in those cases.
And do you suggest any specific doctor to approach?
Hello.
No, any homeopath, classical homeopath, basically you can see any classical homeopath. They will help.
Okay. Thank you, ma'am.
Can I answer that question?
Yes, sir.
Hello.
Yes, sir.
The question was homeopathy in alopecia. That was the question.
Yeah, exactly.
Yeah.
Yeah, that was the question.
Yeah, we have a wonderful, at least I have wonderful results in alopecia with homeopathy. It basically depends on the constitution. Okay, because in homeopathy, we study from which part hair is losing. Front forehead, occiput, side of the head, even eyebrows, genitalia. There are separate medicines almost for each of these areas, which you will not find in any other system of medicine. The results are wonderful in homeopathy. Mainly based on the constitution of the person.
Okay, thank you, doctor.
Yeah.
Okay, if no further question, let's close the session.
So one last word I want to say, one advantage with homeopathy, somebody comes for treatment of alopecia. If you give his constitution medicine, without his telling you, most of other problems also will go.
Yes. This is the beauty of constitutional prescription. We prescribe for one and the other problems are also solved without the notice of the patient.
I would say this way, instead of multiple medications for single problem, we have single medicine for multiple problems.
Multiple problems.
Yeah, that's the real homeopathy.
That's real homeopathy.
Yeah.
Can I ask one question to audience? One question.
Audience means
Dr. Reddy.
You all are audience.
No, Dr.
Yeah.
Reddy, what made you to shift from allopathy to homeopathy? Did you see what made you?
Sir, who will shift from allopathy to homeopathy? You can just imagine my health problems.
Regarding Dr. Adil Chimtanwala is different. I know the reason without his, he comes from a homeopathy family, maybe whatever reason. Okay, but you shifting, why?
I worked as assistant professor of pediatrics in Hyderabad for about 8 years. After having health problems, multiple health problems, I tried it.
To whom? Yourself?
Yeah, that's what I'm telling you. Multiple health problems. Then I tried systematically one by one. Ayurveda did not help me. Yoga helped me to some extent. Acupuncture, I learned, it did not help me. Then finally I landed in homeopathy. At least I did not find the remedy, but whatever symptoms I had, I could see those symptoms in the book, which I cannot see in any other system of medicine. It's my health problems which made me change to this. And I'm really amazed to see the results, particularly any chronic disease. You give me any chronic disease, I will show you results in at least 7 to 8 out of 10. Yeah, that is my level of confidence now. I have patients in Qatar, I have patients in Dubai.
Good. Thank you very much. Good. Thank you. No, I got the answer. Okay.
Bye.
A good session.